असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मा अमृतं गमय.
Good evening and welcome. Antibiotics are a lifesaver and therefore should be used very judiciously and appropriately. There is a pressing need to create awareness of rational antibiotic prescription amongst the medical fraternity. And therefore this Maha IAP has organized this wonderful quiz for all. I welcome our experts, Dr. Baldev Prajapati sir, Dr. Jayant Joshi sir, and of course the different participating teams from different part of the Maharashtra, the office bearers of Maharashtra State IAP, Dr. Hemant Gangolia sir, who is the president, Dr. Amol Pawar, Dr. Jay Bhandarkar, who is the scientific convener, and also Dr. Chetan Trivedi, I welcome him, and Dr. Snehal Nagre, and of course I welcome all of you and our or the audience who are watching it on YouTube live also. So let me just begin by asking Dr. Hemant Gangolia sir to give his address of opening remarks. Sir. Over to you, sir.
Thank you, madam. Good evening and namaste to each and everyone to this fine evening. And we are extremely fortunate to have a great stalwart as an expert, Dr. Baldev Prajapati, Professor of Pediatrics from Ahmedabad, as well as Dr. Jain Joshi from Pune. And we have also Dr. Chetan Trivedi sir from Gujarat. Also, all my office bearers, my secretary, Dr. Amol Pawar, the state convener, Dr. Jay Bhandarkar, as well as Dr. Snehal Nagre, one of the EB, Maha IAP EB members, and all those who are present on the Zoom dais, as well as team leaders of all 5 zones, Mumbai, Konkan, North Maharashtra, West Maharashtra, Vidarbha, and Marathwada. All 5 teams, the participants of the 5 team, wish you all the best for this quiz. Every year we celebrate this National Antibiotic Day, which is on 26th of September, as well as we celebrate the week also. We have different themes each and every year, but the mission is the important theme. The important thing is mission AAA, avoid antibiotic abuse. And we all are responsible, all medical fraternity are responsible for that. And we should learn from this anyway, from our experience, from our practice, from our colleagues who are doing. And it's nothing that it is only general practitioners, but it's all general pediatrician and all specialties. Everybody, some other time, they misuse the antibiotic. So it's not a blame game that you are using, you are not using. That's not the thing. We have to learn, and we have to learn the rational thing which we should do in our practice. Of course, as time goes, we learn. And probably the quiz, we always see the talks being given on these antibiotics, but rather this is one of the innovative way, which was actually is the brainchild of our Dr. Jay Bhandarkar. And last for 2 years, we are organizing so many quizzes on various topics. And so this is an innovative way to learn the things. So wish all the teams best and hope so this will be the learning program to each and everyone. We learn from each other, from each other's mistakes. Thank you very much.
Thank you, sir. Our chief guest today, Dr. Harinder Singh, who's the VP of North Zone 2022, couldn't join because he sends his regrets. Now I'll request Dr. Amol Pawar, who's the Secretary of Maharashtra State IAP, to say a few words, please.
Thank you, Sunita ma'am. Good evening, all, both the experts, respected Dr. Baldev Prajapati sir, Dr. Jain Joshi sir, today's guest, Dr. Harinder Singh sir in his absence, then Dr. Chetan Trivedi sir from Gujarat, President Gangulia sir, Convener Jai sir, all Maha IAP executive body members, all participants of all 5 zones of Maharashtra, mainly Mumbai and Konkan, North Maharashtra, West Maharashtra, then Marathwada and Vidarbha. Today we are conducting antibiotic awareness quiz to celebrate National Antibiotic Day, which was on 26th of September, with the aim to increase the importance of rational antibiotic awareness and encourage best practices among we general public health care providers and avoid emergence as well as spread of antimicrobial resistance in the future. Thank you once again for sparing your time from your busy OPDs for this wonderful initiative by Team Maha IAP. All the best to all teams, and over to you, Sunita ma'am. Thank you.
Thank you so much, Dr. Amol. Now, we have with us 2 very eminent pediatricians as experts for this quiz, Dr. Baldev Prajapati sir and Dr. Jain Joshi. It is an honor to introduce Dr. Baldev Prajapati sir. He is an HOD and professor at GCS Medical College Hospital and Research Center, Ahmedabad. Sir is very well known figure in IAP and has held many important positions in Central IAP. He's been awarded with many orations, latest being Dr. Ashok Kapse oration in 2022. Sir has written many articles and books. Special mention here is Essential Procedure in Pediatrics, besides being invited as a speaker for innumerable academic events. We welcome you, sir, and I request Dr. Baldev Prajapati sir to please give his blessings.
Good evening, friends. I think it's a definitely unique way of celebration of this week. All of us know that this is very important challenge, not only to the society, but to these medical persons. And I'm sure that this is just one of the modes to sensitize all the friends and ultimately remind that what is the importance of the rational antibiotic practice. And I'm sure that with this exercise at the end, we'll have certain messages. So only my request that please translate these messages in the practice, not just only for the academics, not just for quiz, or not just for the article or reading. It should be from tomorrow morning translated in the practice as far as possible. I'm sure that the purpose is served. Thank you very much. Thanks, Dr. Amol, Dr. Hemant, and all the team members for giving me this opportunity. Over to you, please.
Thank you so much, sir. Now, I'll introduce our next expert, Dr. Jain Joshi, sir. Sir is Senior Consultant at Dinanath Mangeshkar Hospital and Sayadri Specialty Hospital in Pune. His main areas of interest are infectious diseases, pulmonology, vaccinology, and neonatology. Sir has held many important posts at the central as well as at the state level as well as the local branch, that is the Pune branch level. He has been the national trainer for various IAP modules like asthma training module, rational antibiotic practices, tuberculosis, RTI GEM, under 5 visas, touch module, and many more. Sir is a member of IAP guidelines on pediatric cough therapy and also has few publications in journals and books to his credit. I'll request Dr. Jain Joshi, sir, to please give his blessings. Over to you, sir.
Thank you, Dr. Sunita, for that kind introduction. Am I audible?
Yes, sir.
Okay. So, greetings to everyone. Welcome, respected Dr. Baldev Bhai. Warm greetings, Dr. Chetan, my dear friend. And many thanks to Dr. Hemant sir, Dr. Amol, Dr. Jay, and all the office bearers of Maha IAP for once again giving me an opportunity to participate in some topic which is very close to my heart. It was my privilege to be associated with the first module which was devised under the leadership of Dr. Vijay Evle and where rational antibiotic practices was being held. And I was fortunate to be a part of that module. And ever since that, I have been participating in this module everywhere. As Dr. Baldev Bhai mentioned, it is a need of the hour that all of us become aware of the fact that antibiotic usage must be done rationally, must be done minimally, and must be done only whenever there is required, because of the great risk of antimicrobial resistance. And soon probably the bugs will overcome us. So that probably situation we don't want to have. And that is the reason why the importance of today's day and today's week. And it's a very novel way. I must appreciate and congratulate Maha IAP for this novel activity, because sometimes didactic lectures and seminars can be a little boresome. But if you have something which comes in a practical form, in the form of a quiz, which can generate interest amongst the members, probably the take-home message would be more relevant and more efficient. So as Baldev Bhai said, I also suggest that all of us should follow rational antibiotic practices from tomorrow in your practice. And thank you very much for the opportunity. Looking forward to the quiz. Best wishes to all the quiz participants, and many thanks once again.
Well said, sir. Thank you so much. Yes,
Thank you, Dr. Jayan Joshi, sir. We acknowledge the presence of Dr. Chetan Trivedi, sir, also. I will request him to say one or two lines. And before he says, an interesting thing I want to say, because what Baldev Prajapati said and what Dr. Jayan Joshi said, to put in the implementation, we may not be 100% right, but try to achieve something to be 50 to 60, 70%. An interesting thing I want to mention here, whenever because most of us learn from the medical representative who visit us, and what they do, I will tell you one example. When they come to general pediatrician, when they show the visual aid, they will never show the cefizime to be used in respiratory tract infection. But same visual aid, when they go to general practitioner, they show cefizime can be used for respiratory tract infection, upper and lower also. So that we should understand as a general pediatrician as well as general practitioners, because these tricks played by the pharma companies, we should learn from all these things. Yes, Dr. Jeta Trivedi, sir.
First of all, I would like to congratulate Maharashtra IAP, my IAP, for this wonderful way to give the importance to the antibiotic awareness. And no other technique or no other way we can do best way, that's the quiz. And so I must congratulate all of you, Dr. Hemant, Dr. Jay, Dr. Amol, Dr. Neha Singh, Dr. Sunita. Thank you for giving this opportunity. As such, I am here to learn, honestly, because when a person like Baldev Prajapati, when he is there, you must know that you have to learn as much as possible, because he is teacher of teacher. So it's our good fortune that he is there on the screen with us. So I will request all of you to please get the maximum knowledge. Forget about this quiz, but this is the best way you can learn, because I am very closely associated with him. He is from my city, so I am getting more opportunities. But nowadays, with because of the post-COVID era and during COVID, everybody is now lucky to have him just a click away from you. So just please enjoy the quiz. And first of all, and once again, I would like to thank all of you for this wonderful opportunity. I am here to enjoy. So I think I better switch to YouTube and enjoy this quiz. Thank you so much.
Thank you so much, sir, for your kind words. Now I will hand it over to the Dr. Jay Bhandarkar and Dr. Hemant Gangolia, sir, for further proceedings of the quiz.
So thank you very much for all these informal things. Now we'll proceed to the quiz, and I will share the PPT. We will do the naming ceremony also, and then Jay will take over from the rules and regulation. Yes, Jay, do you want to say one or two lines? Otherwise, I will just share the presentation, just go to the things.
Okay. And we'll do the naming ceremony. I will speak at that time only.
Yes. So Maha IAP presents antibiotic awareness quiz, and 26 September is the National Antibiotic Day. We are celebrating today as in form of quiz, and our quiz master is Dr. Jay Bhandarkar, sir, state convener Maha IAP, quiz coordinator being myself and Dr. Amol Pawar, Secretary General of Maha IAP. Experts, we are extremely fortunate to have the experts as Dr. Baldev Prajapati and Dr. Jain Joshi, sir. And of course, this is a joint teamwork. So we have our support team, Dr. Sunita, Dr. Vishal, Dr. Neha, Dr. Abasai Patankar. Then we have 5 teams. So these are the teams. First team is Team Mumbai Konkan, and the team leader is Dr. Rajesh Shinde. If he has joined, please introduce yourself and your team members. Dr. Rajesh Shinde, are you there?
Yes, sir.
Yes. Please
Hi, sir.
introduce yourself and your team members.
Thank you very much, sir. Dr. Gangulia, sir, Dr. Jay Bandar, sir. Very happy to be here with such a stalwarts. Myself, Dr. Rajesh Shinde, practicing in rural area of Raigad, Polatpur since last 22 years. My colleagues are Dr. Suryakant Pandit, sir. He is MBBS and practicing since last 45 years in Vasai. Dr. Yuvraj Mashelkar, he is BHMS and CCMP. He is practicing in Rasayani. Dr. Manisha Jobanpadra, she's staying in Mumbai and she is practicing since last 22 years. Dr. Milind Garad is BHMS and he is practicing at Panvel since last 25 years. So these are my colleagues, and we welcome all of you, and we wish all the best to all the other teams. Thank you very much.
And Dr. Rajesh Shinde is closely associated to our Dr. Dabarkar sir, Vice President Zone 2020. The another team is Team North Maharashtra. So the team leader is Dr. Pankaj Palve. May I ask Dr. Pankaj sir to introduce yourself and your team members, please?
Good evening, all, sir. This way, sir. Myself, Dr. Pankaj from Jalgaon. And thanks all of you for inviting us for this event. My team members are Dr. Umesh Patil, practicing in Jalgaon. Dr. Kapil Purbe is also practicing in Jalgaon. Dr. Rahul Patil is also practicing in Jalgaon, and Dr. Jagdish Patil is practicing in the periphery region, Neri.
Thank you, Dr. Pankaj. Our next team is Team West Maharashtra, and our team leader is Madam Dr. Priya Darshini. May I request Madam to introduce yourself and your teammates?
Priya madam.
Priya Darshini is there?
Yes, she is there. Priya ma'am, please introduce yourself.
Amol and Jay, you can see the screen because I cannot see the screen because I'm sharing the PPT. So I
Okay. So the Western Maharashtra team leader is Dr. Priyadarshini Wagale, and her team members are Dr. Shubham Mule, Dr. Asif Seth, Dr. Sridhar, and Dr. Manisha Kandare.
Amol, she has come. She wants to tell her to unmute. Dr. Priya is also there now.
Yes.
Tell her to unmute.
Priya ma'am.
Dr. Priya, please unmute.
Yes, sir.
Yes. Yes, please
Yes.
introduce yourself.
So myself Priyadarshini Wagale. I'm BMS doctor practicing in Solapur. I'm representing alone for my team. My colleagues are not present here because of their personal reasons.
Madam, you can call them and you can request them to join at any time whenever they are free. Yes, yes, madam. And probably yes.
Yes, sir.
Next.
All the best, madam. Probably I have requested one of the doctor from Raigarh, Dr. Hemant Shewari, to join. If he is there, I will ask to become your team member if another team don't object. Okay. So we have another team, Team Vidarbha.
Okay.
Yes. Dr. Deepak Raipure sir is there. Please introduce yourself and your team. Dr.
Yes,
Deepak.
yes. Thank you, sir. Thank you for watching. I am from Nagpur, Vidarbha. My name is Dr. Deepak Raipure. My team members are Dr. Sanjana Lal from Yotmart, Dr. Shilpa Rahmatkar from Nagpur, Rajesh sir from Nagpur. Hello.
Yes. Some connectivity
Dr.
issues
Revat
there.
sir.
Yes.
Dr. Revat sir.
Thank you very much, Dr. Deepak. So these are the 5 teams. Thank you very much for introducing yourself. And the important thing, we want to do the naming ceremony. These all 5 teams, whatever the slide we have, the quiz we have prepared, it is as per our sequence of the new team, new names. So we will just name this team, and I will request Dr. Jay as well as Dr. Sunita to note down which are the teams. So and I will request our expert, Dr. Baldev Prajapati sir, do the honor of naming this thing. And probably I presume that sir is ready with the bowl with the cheats, and whenever I ask, he will just show that he will be taking the cheat out. Baldev Prajapati sir, are you ready, sir?
Excuse me, sir. Hello. Excuse me, sir.
Yes.
Your introduction is revealing, sir.
Yes, yes. Carry on, carry on. Sorry.
Yes,
Sorry.
myself, sir, Dr. Deepak More, Ayush Medical Officer at practicing at Hingoli. Our senior doctor, sir, Mr. Dr. Vittal Karpe, sir, working at District Hospital Hingoli. Dr. Bhakre, sir, working at DH Hingoli. And Dr. Pardesh, sir, Santosh Pardesh, sir, working at Hingoli District Hospital. And Dr. Alok Gottu, sir, working at PSC Bandegaon. Thank you, sir.
Extremely sorry, Dr. Deepak Mori, sir, for that, because one slide went because of in search of Dr. Priya Madam. Okay, so that slide we got lost. Anyway, Dr. Baldev Prajapati, sir, is there? Hello?
Unmute, sir. Unmute.
Hello?
Unmute कीजिए, sir. Unmute कीजिए.
Yeah, sorry. Dr. Ahmed, I am here and
Yes.
you can see the ball in my hand with the 5
Yes.
sheets.
Yes. So the first name which we want to give the team is penicillin. So I will request our expert sir to just pick up one of the sheet from there and just announce which team is penicillin. And Dr. Jay and Dr. Sunita, please note down.
Penicillin is Marathawada.
Penicillin is Marathawada.
Yeah.
Marathawada, na sir?
Yeah, Marathawada.
So Marathawada team, you have got the new name as penicillin. So henceforth you will be addressed as penicillin. Our second team name is cephalosporin.
West Maharashtra is cephalosporin.
So West Maharashtra will be cephalosporin. The team leader, please acknowledge you being your new name is cephalosporin. Team leader of West Maharashtra.
Yes,
Dr.
sir.
Priya Madam. So you are cephalosporin.
Yes, sir.
Most effective.
Okay.
The third team name is macrolides. So sir, please do the honor.
Yes. Mumbai Konkan is macrolides.
Okay, macrolides, that's fine.
So Mumbai Konkan team leader, please acknowledge your new name. What is your new name?
Thank you, sir. Macrolide.
Macrolides.
So
Macrolide, Mumbai Konkan.
So now fourth team is quinolones. Sir, please do the honor.
Vidarbha is a quinolone.
So
Vidarbha.
Vidarbha, please, team leader, acknowledge
Yes,
your
sir.
new name.
Yeah, quinolones from
Quinolones.
Vidarbha.
Yes, thank you very much. And the last, of course, is the beta lactams, and probably the last left the thing. Please, sir, do the honor.
North Maharashtra.
So North Maharashtra, team leader, please acknowledge your new name and please acknowledge your new name. North Maharashtra, Dr. Pankaj sir.
Yes, sir. Yes, sir.
Yes. So
Yes,
what's
I
your
got it.
new name? North Maharashtra.
Beta-lactam.
Beta lactams. I see that your that screen is named as Avinash Bhosle, and I will request Dr. Avinash Bhosle not to be around there answering the questions and help them. Please, he's a zone coordinator.
He's not there with us.
Okay. So with that we finished the naming ceremony. Sir, can you announce once more, or should I in on our behalf?
I think Dr. Hemant, you may do.
Yes. So as per whatever sir had did the honor of naming the ceremony. So penicillin is Marathawada, cephalosporin is West Maharashtra, macrolides is Mumbai Konkan, quinolones is the Vidarbha, beta lactam is the North Maharashtra. So all teams, please remember your new names, and because on presentation we will be seeing these new names, and whenever your team will be asked by our quiz master, you have to be present with your video and audio on, and rest of the team should make their video and audio off. So with that, we have finished the naming ceremony, and we move to the rules and regulation. From here onwards, I hand over to Dr. Jay Bhandarkar sir. Yes, Dr. Jay.
Dr. Hemant, thank you for a wonderful start of this quiz and all the formalities. So that's just rules and regulations already known all of to you. There's a 5 teams, 4 to 5 members in each team. Team Mumbai, Konkan, North Maharashtra, West, Maratha, and Vidarbha. We know the name of different. There will be 3 rounds. Round 1, multiple choice questions, question with multiple options, 3 questions in each round. We'll call every team at once and ask the 3 questions during the round. 10 points for the correct answer and 0 points for the wrong or no answer. Time duration is 15 seconds. And round 2 will be also same. It will be 3 questions at a stage. We call 1 by 1 team and multiple choice. 10 points for the correct answer and 0 for the wrong answer. Time duration again 15 seconds. Round 3 will be rapid fire. Time duration is 60 seconds or maximum 6 questions, whichever is early. And please remember, during this rapid fire, you should assign only one person who can answer so that you can very well attempt all the questions, as well as I can concentrate answer from that person. It may be team leader or any other person. And there is no passing a question to one team to another team. And first answer given by the team leader to the quiz master will be taken as the final answer and typically in the stipulated time. And most important, decided by adding all these round 1 and 2 or 3 marks will be added. If there is a tie of the team, then the tie question will be asked. Most important things to be remember here, the quiz is very simple, very easy. The team called will be keep their audio video on. All others other than organizers will keep their audio video off, and there's no chatting on the chat box, because even minor even noise also is very well I think heard on this Zoom dais. Another thing, when I say your time starts now, that time you start speaking. Don't start speaking once the question is on the dais, because you start speaking, then other audience will not able to hear the question properly, and there may be some ambiguity in some questions. Referee is there, and we'll go to that. And quiz master decision is final, and all questions are prepared. Some are tricky, you have to hear very properly. You'll get enough time, more than 15 seconds to think over it. So I think this is thing from my side, and I see you should proceed for the wonderful quiz. So he's the first team.
Dr. Jay, just a request to express Dr. Baldev Prajapati sir. At any point of time, if you want to say anything on the slide, you can just intervene. Just I want to say, sir, and you can just ask Jay to say, sir. Okay.
Certainly.
So with that,
Thank you.
and as well as to Dr. Jain Joshi sir. So with that, we move to round 1. Yes, Dr. Jay, start.
Yeah. So round 1. Who is the first team to be present? Yes, Team Penicillin. Are you ready, Team Penicillin? Who is the captain of Penicillin? Current team. Other teams, please, audio, video off. Yes, I want to see everybody acknowledge present, present, present.
Yes,
Okay. Yeah, so they are sitting at one time. Are you ready?
Yes, sir.
Penicillin. Yes, this is the first question. For this, please, Hemanji, put this question. 2-year-old child brought with history of high fever for 2 days, watery nasal discharge, cough, temperature of 101 degree Fahrenheit, throat congested, system examination within normal limits. What are the treatment options? First, syrup amoxicillin, syrup paracetamol. Second option, syrup paracetamol, decongestant, saline nasal drop, syrup azithromycin or syrup paracetamol. And D option is syrup cefixime, cough syrup, syrup paracetamol. Your time starts now.
Sir, answer is B.
Who is the team leader?
Dr. Deepak More, sir. Answer is B.
Okay, so you are the team leader. That I have registered the answer B, and they came very spontaneously. I think more confident, like hitting a 6 on the first ball of the match. So let us confirm this answer.
Yes, sir.
You are fantastic, right? So team scores 10 marks. Scorer, please note. बलदेव सर, आई ऑप्शन मैं कहना चाहता हूं कि 101 फीवर है तो एंटीबायोटिक देना चाहिए सर. विदाउट एंटीबायोटिक कैसे भेजेंगे इस बच्चे को? बलदेव सर.
Yeah, you want to ask me?
Yes. Why? I want to give the antibiotic. This patient 101 degree fever है sir patient को 2 days से.
What you want? Always ask the question to yourself what you want to treat.
Yeah.
I think here the what case scenario is given. High grade fever, but nasal discharge, cough, it indicates very simply that it's a viral. And even systemic examination, rest of the system is normal. So very definitely it is viral. And once you say viral, you know that for that we don't have the antibiotics. And
Yes,
if
sir.
if I remind you, always Ambedkar sir says, write down your diagnosis. If
Right.
you write down viral, probably you will go for the B option and not others.
Yeah, fantastic, sir. Sir, can you give about some important points how I differentiate between viral infection and bacterial infection? 2 points.
Yes, I think very important. Please remember, very simple. Viral infection may start with a high-grade fever, but multi-system involvement is the characteristic. Suppose if it is upper respiratory, some cough and nasal discharge, sometimes simultaneously, maybe even with loose motion or diarrhea, sometimes with the skin rashes, and not only one particular person in the family, but multiple family members. Sometimes with as a whole, it is a problem of the community. And I think that it becomes very clear message that this is viral. Bacterial may start with this low grade and then gradually increasing. Meanwhile, it will having this very localization, and child will be having the toxic or sick looking, and even the decreased appetite, decreased activity, may not be the good effect of the antipyretics. In the viral, there is a good effect of the interpyretics. Interfebrile period, if you see in the viral, child is playful, better, where in the case of the bacterial infection, even in the absence of fever, child does not look the totally normal. And I think these are the very simple, basic things, but it works very well. Confidently, most of the patients, whatever you have diagnosed, viral or bacterial, and I think this we should follow in daily oral practice. Probably if you follow, several patients will stop to give the antibiotics.
Thank you, sir. Point well taken. So now moving to the second question of the first round. So neither antibiotics not warranted can be viral you are type 2. Yes. Hemant sir, this is the second question for Team Penicillin. Are you ready? 4-year-old presented with high-grade fever, throat pain. Examination toxic febrile weight is 15 kg. Local examination purulent exuded on the both tonsils. A clear-cut diagnosis of bacterial tonsillitis. So, what is the dose of amoxicillin and duration? There are no options. You have to answer directly. Your time starts now.
In proper milligram per kg as well as duration.
Keep watch on the timing. Unmute yourself. Deepak, तुम्ही unmute आहात. Mute आहात तुम्ही.
50 milligram per kg for BD for 7 days.
Okay. Let us. Our diagnosis is bacterial tonsillitis. Quiz banker Dr. Hemant just confirm. So that our 50 milligram per kg in 2 divided or 3 divided doses for 10 days. Baldev sir, it is right our answer. 7 days.
Absolutely. I think why the 10 days?
Right.
Why not the 5 days? Why not the 7 days? And
Please
I think that if you are clear, then not the mistake. Here you know that most commonly what is the likely organism, right? And that organism as a late complication can go for the rheumatic fever and even this nephritis. So to prevent these problems or complications, late complications, probably here if you don't give the antibiotic, then also many patients will recover. But the late complications cannot be prevented. And for that reason, this duration is actually sharply if you want to give 9 days. But I will say best to eradicate the organisms totally, duration should be 10 days. And I think it's very important that don't compromise, otherwise your purpose of giving the antibiotics will not be served. So right. Dose is 50 milligram and that is for 10 days is very appropriate. I think Nelson has given the 80 to 100. Why we are following 50 milligram?
Right.
Because the resistant problem which they are facing the Western countries, fortunately somehow at present we don't have this very common, and right. Therefore I think our dose 50 milligrams sufficient. We need not to increase 80 to 100 or so.
Okay.
Sir, they have answered for 7 days. Should we give them right or wrong?
Sir, I think we should not give the correct.
Right.
It's wrong.
Okay.
Okay.
Dorar,
and one more thing, sir. Most of the time, as a practitioners, as a pediatrician, as well as we are in fear of that amoxicillin दिया तो लूज मोशन होएगा, तो बहुत टाइम उसको है ना प्रोबायोटिक्स या प्रीबायोटिक्स जोड़ देते, तो जोड़ना चाहिए नहीं जोड़ना चाहिए?
I think nothing is required. This is just
Yes.
our apprehension. Just
Yes.
our apprehension. For one medicine, the second, and for the second, the next third, I think that sequence does not require. It should be very clear. At the most, you can give after food or so. By chance, even some discomfort, you can advise, I would say, curd, rice, like something like that, and it works very well. Most of the times, children are able to tolerate. This is just our apprehension.
Dr.
Dr.
Jay,
Jay,
our second expert, want to
Right.
add something?
Yes, Dr. Jay, they have answered half right, 50 milligram kg, but duration is wrong. So you decide about the marks to give.
No, we are not giving.
Till the time, Dr. Jain Joshi will yes want to say
There's
something.
no marks.
No, I think as Dr. Baldev sir said, the duration is very important because we are trying to prevent the late complications like rheumatic fever. So when your diagnosis is bacterial tonsillitis, the duration has to be 10 days. Sometimes even in a condition like pneumonia, you can give antibiotics for 5 to 7 days because there probably the streptococcal pneumonia is a common organism which gets easily responsive to amoxicillin. Now coming to the bacterial diagnosis, I must make a mention that clinically, while diagnosing it, one must apply the Centon criteria as one of the important diagnostic criteria in your practice. So I think if you are examining the child, you must ask for the duration of fever. You must palpate for the anterior cervical lymph node. Absence of cough is a very important thing. Of course, on examination, tonsil infiltrates. And these are the criteria which probably will go strongly in favor of a bacterial tonsillitis diagnosis. So I think whatever Dr. Baldev sir has said, I would just like to add to that, but no points for this answer.
Thank you. We are moving ahead for the third question.
Dr. Jay,
Yes,
why not the correct answer? You know, if you give the less than the 10 days, 7 days, half rheumatic is not going to develop.
Right.
If rheumatic develops, it will be the full rheumatic. So
Right.
I think half mark, less mark should not be there.
Right. Sir, हमारे quiz में half mark नहीं है, full mark है. Thank you. So we are moving on to the third question. Team Penicillin, are you ready? Which of the following can happen after taking antibiotics? Yeast infection, B, severe diarrheal infection called Clostridium difficile infection, allergic reaction, D option is all of above. Your time starts now.
All of the above. All of the above is
Okay. So I have registered your answer is D, all of the above. Yeah. So you're perfectly right. तो आपने चौका मार दिया है. All of those is the correct answer. So is the all it can have all the side effects. So thank you very much. Team Penicillin, your round one आपका खत्म होता है. Your and scorer, what are the score they have scored?
Team Penicillin has scored 20 in round 1.
Yeah, fantastic. So please, you keep your video audio off, and the team is Team Cephalosporin, West
Maharashtra. West Maharashtra.
Who is the captain, leader, other members? West Maharashtra.
Yes, sir. West Maharashtra. Yes.
Okay, so I will call your
Dr. Jay, Dr. Priya is there. Can you see Dr. Hemant Shewale on the screen anywhere? If he's there, then you can join this team. If he's there, otherwise, okay.
So we are moving ahead then. She's okay.
Yes, yes.
Dr. Hemant Shewale joined, right? So,
Yes, sir.
Dr. Hemant Shewale, you are in this team of West Maharashtra because West Maharashtra Dr. Priya Madam is there and other 4 members didn't join. So for today, you are the team member of the West Maharashtra. So you have to your team
Sir,
leader.
I am Dr. Manisha Khandare.
Acha, Manisha Khandare is there.
Manisha Khandare madam also came. So 3 members are there.
3 members are there.
Hemant sir, तुमचा Hemant Shewale sir video on करा.
Okay, sir.
Video on करा. Everybody, all yes.
You can discuss online while giving the answer also.
Yeah. So simple thing, Hemant Shewale sir, तुम्हाला 15 सेकंद मिळतात. तुमचे टीम लीडर आहेत प्रिया वागळे मॅडम त्या आन्सर करणार आहेत. Yes. So the first question for the team Cephalosporin on the diet. 3-year-old brought with complaints of fever, cough, cold, noisy breathing for 2 days. On examination, temperature 100°F, throat congestion, respiratory system bilateral bronchi, vitals normal, child active during a febrile period, the treatment options are syrup salbutamol, syrup paracetamol, nebulization with salbutamol. B option, syrup azithromycin, paracetamol, and nebulization with salbutamol. C option, syrup Novomox, syrup paracetamol, cough syrup. And third option, last option, that is the D, tablet Visalon, syrup cefalexin and cough syrup. So your time starts now.
Option A.
Okay, the team leader answered option A. And you know the rule is when you answer first answer, that is taken correct. So just I will wait for the, okay. So you are perfectly right. You are also hit on the 6 on the first ball. So this is this patient had a low respiratory infection, right?
Yeah.
100 fever. Why don't the antibiotics? Or I want to give it azithromycin. Maybe bilateral lung infection is there, right? We're not given antibiotic here.
So the whole thing, if you look at the history, the child's onset is acute. There is fever, there is cough, cold, and on examination, the child has bilateral bronchi. So obviously, it is something which is a lower respiratory infection, which is mostly arising out of viral origin. Now, in such a situation, most of the times these are situations where it can be either a RSV virus or a rhinovirus, or it can be even influenza virus. And in such a situation, you will have an onset of fever, cough, cold, and noisy breathing. So here, the correct answer is you have to give a bronchodilator, salbutamol, and paracetamol as and when required. And if the child is showing severe respiratory distress, one can try nebulization, but that is not the right recommendation now, because since I come from the respiratory chapter also, the ideal thing is to give salbutamol inhaler. Right. So I think, but more often than not, I think this answer is acceptable, that salbutamol, syrup, paracetamol, there is no indication of using azithromycin. And we all know that azithromycin is severely misused over the last 2 years in COVID period also. And this is one molecule which must save, because of late we have been finding macrolide resistance coming into picture. The role of Novomox has no meaning here, because we are not tackling with a viral bacterial infection. Use of cefalexin, oral Visolon, oral steroids sometimes can have an indication in such a situation if a child is having severe respiratory distress. But coming to the antibiotic choice, there is no indication of using an antibiotic in this situation. And the correct answer is syrup salbutamol, paracetamol, and if SOS required, nebulization salbutamol. Thank you very much.
So can I take message from you? Bilateral lung involvement generalized more of a in favor of viral infection. As simple it is. Right? Localize one side, we can go for the bacterial. Thank you very much, sir. So moving ahead with the second team. 2-year-old female child brought with fever and burning micturition, clinical signs of lower urinary tract infection. What is the dose and duration of cefixime? Right? We have to mention here 8 mg per kg as well as the duration. Your time starts now.
Milligram per kg plus duration in days.
10 mg per kg per day for 5 days, 5 to 10 days, or
okay, I have registered the answer 10 mg per kg for 5 to 10 days. Let us see the answer. Yeah, so we are here 8 mg per kg per day divided into 2 doses for 7 days. So I again go back to our expert. Sir, can I take her answer, Dr. Pia's answer, as a correct or not?
I think she's nearer to correct and does not make a difference in the science. So you can consider the correct.
Okay.
But here, you know what is our idea? That 3 years old child, usually I think lower UTI is not common.
Right.
Let me make the point. But still some of the fatality is there. The cefalexin is the drug, cefixime is the drug of the choice. Dose is 8 to 10 milligram per kg per day in 2 divided doses. And even 5 days is maybe the suffices in most of the times in the lower UTI, because this child is not toxic. It does not require the penetration for longer time. So I think the correct answer should be 8 milligram per kg per day for 5 days.
Okay. I think
but it's okay. I think 7 days.
So what about afloxacin?
I think In the urinary tract infection, if I want to give the clear message, first decide is it UTI?
Right.
And the number one from the symptoms, and it always go by the confirmation.
Okay.
Suppose once you decide, then if it is the lower or even the child is having this good condition, able to take orally and tolerate oral medicine, and oral cefixime works very well. If really child is having the acute and toxic or the complicated UTI, what we say, very high grade fever, toxic child, vomiting, not able to tolerate orally, in such patients you may have to go parentally, and in that case the ceftriaxone. And once probably it settles down, child is able to take orally, you can switch on the cefixime. I think beyond this, if necessary, you can go for amoxicillin or amoxicillinic acid, but other antibiotics are hardly required. And particularly the quinolone, the child is 3 years old. Even if it is effective, then also we are not allowed to use. And please never breach the law. Don't invite trouble. I think when I'm talking to Dr. Hemant, he will agree with me that as far as possible, and really if the situation arises, take the opinion of 2-3 persons, document, then to go for the liberty.
Right.
The case like cystic fibrosis, but not in the routine practice, very dangerous. Therefore, there is no question of quinolone, I think, in this patient.
Thank you, sir.
Message is either the cefixime or even this ceftriaxone. Beyond that, hardly few patients will require to go further. And that too, you can go for culture sensitivity.
Yes, sir. Thank you, sir. So,
Jay,
please
Dr.
note.
Jay, can I just add a line, Dr. Jay?
Yes, sir. Yes, sir. Please, please.
Yeah. So in addition to what Dr. Baldev said, there are two things. One, don't interpret. Urine examination has to be done. Urine sample collection is very important. Don't interpret only presence of pus cells as a sign of urinary tract infection. If possible, whenever possible, always go for a urine culture. If the clinical setting suggests that there is fever and symptoms, a 3-year-old child can express symptoms like dysuria. So if there is any doubt, please proceed for culture, and according to that, decide your antibiotic choice. Thank you.
Thank you. So, scorer, please note they have scored 10 marks in this. So, I'm moving out teams. Third question. What are some of the best ways to stay healthy and keep others healthy? A. Cleaning hands with soap water and using hand sanitizer with at least 60% alcohol. Staying home when sick. Getting all recommended vaccines, including the seasonal flu vaccine. And D option, all of the above. Your time starts now.
All of the above.
All of the above.
So, Priya madam is spontaneous. 3 seconds she taken the answer is correct. All of the above. So, thank you very much. So, your team separation your first round ends here. Scorer. Score काय झाला त्यांचा?
Yes, yes. Team B has cracked it 30. Scored 30 in round 1.
I think just, Dr. Jay, before you go for further, can you go that this last slide?
Okay, sir.
I will appreciate, and I think the message to all of us. This is the best question and best answer and best to translate in the practice. All of us know that infection is usually spreaded by these wrong practices, and that's simple, cleaning the hands. And all of us seen during the COVID time that how much it is useful. So I think very well, particularly the medical persons, during a round, during our working in ICU, PSU, just if you observe these precautions, these measures, we'll have not to search for the meropenem.
Right.
Because automatically it can be prevented. So I think it is cheapest and most effective way. And I think all other measures are really quite important. Just to draw the attention of all the friends that please try to translate in the practice.
Yes, sir. Thank you. So, team, next team is team macro lead. Lady Mumbai Konkan, Rajesh Shinde, I think is the leader. Other members, please acknowledge.
Yes, sir.
Present, present Mana Sahib. We were. Please, Dr. Priya madam, video audio off. Only team Mumbai Konkan. Are you ready, Rajesh?
Yes, sir. Yes, sir.
Yeah, this is our first question from the round 1 for the team macro lead. 2.5-year-old brought with complaints of loose motions with streak of blood, high grade fever, hydration normal. System examination normal. Treatment options are option A, syrup Norflox metronidazole, syrup paracetamol. Option B, syrup cefixime, syrup paracetamol. Option C, syrup Oflox, probiotics, syrup paracetamol. And option D is injection amic acid and syrup paracetamol. What is the best answer? You should decide. Your time starts now.
Answer is B. Answer
Okay.
is B, cefixime with paracetamol.
You don't want to discuss with the other team member?
No, sir. They are all with me.
Okay, so I have registered answer cefixime and paracetamol. Yes, that's the correct answer. I think Dr. Hemant Ganguly is in very much hurry to answer also. So he's not asking me to just declare the answer. Just you should wait for something so that I can discuss with the sir.
Yes.
लेकिन सर मैं यो बलदेव सर यहाँ पे तो सर स्टिक ऑफ ब्लड है, लूज मोशन है, तो मुझे तो नॉर्मल मेट्रेज में कॉम्बिनेशन बहुत अच्छा लगता है सर. कॉम्बिनेशन कॉकटेल है मस्त. मैं देखता हूँ प्रिसिशन तो 80-90% पेशेंट मेट्रोजोल दिया जाता है.
I think the person who has framed the question is definitely good, and he must be the practitioner. As you are talking, must have observed all the options. He has not to search because options are available in the practice. But very rightly said, you know, always in diarrhea, when we'll go for the antibiotic, that is number one. Not just stool examination shows some pus cells or RBCs. It's not the indication. So in general, I would say diarrhea disease, don't go for the stool examination. Routine stool examination does not help you. On the contrary, confuses, creates the problem. So it is not indicated. When it is by naked eye blood is seen, I think this is the picture which you are given. Our interpretation is dysentery. And once you say dysentery, antibiotics are indicated. And then what you want to treat again? Most commonly is segellosis. Maybe the salmonellosis and some other organisms. And in that case, what should be the choice? I think cefixime still works very well. Please remember, for the pediatrician, there are only 3 indications for the cefixime. Number 1, enteric. Number 2, already we discussed urinary tract infection. And number 3, dysentery. That means below the diaphragm. Please just to remember, if you don't want to go into detail, cefixime is indicated in the infections below the diaphragm, not the respiratory, which commonly people are using. So that's the point. And then the dose and everything, cefixime and paracetamol symptomatic. Norfloxacin metronidazole, I think amoebic dysentery is very uncommon. And people say that when it should be used, this metronidazole, when you have documented this amoebic and that to the trophocytes in the stool examination, not the ova or cyst. Ova or cyst you are going to get, it does not mean it's responsible for the dysentery. Number 2, suppose if you have diagnosed dysentery and your 2 antibiotics fail, then probably I may consider this amoebic and I will go for the option metronidazole. And I'm sure that if you go for this exercise, hardly it is indicated. It does not require. And never the mixtures. I think as a whole in the science, in antibiotics, mixtures should not be used. Combinations are not indicated. And that to irrational, never. All these probably combinations which are mentioned over here, they are the irrationals. Ofloxacin, already we discussed quinoline, and otherwise also it is registered. So I think it's not for us. Amikacin, when simple oral antibiotic works, there is no question to go for the injectable. So it's a very clear message. Suppose if I don't know, and then also it is my diagnosis is dysentery, then I will go for only cefixime. Again, if the child is having severe abdominal pain, toxic, low, very high grade fever, not able to tolerate, it may require ceftriaxone initially, and then ultimately switch on the cefixime. And I think it works in more than 90%. So don't think for other things.
So one question is there, whether whenever we see case of diarrhea, dysentery, whether we should do stool routine or not?
No.
I think it initially said stool examination is not required. Don't go.
Yes.
On the contrary, it invites the trouble. There is some pus cell. They will make it the yellow or red, and they will show the abnormal. And if you don't give the antibiotics, patient will go person to person. There is the infection and sir is not giving the antibiotics. And therefore I said, don't invite the trouble. Don't go for the stool examination. Stool examination is required when? Compromised child, yes. HIV patient, newborn, in real true sense diarrhea, not just frequency of stool. In immunocompromised children, you may go for the stool examination, not routinely our, I would say, daily practice, acute diarrheal disease, it is not indicated.
And I want to go to our second expert, Jain Joshi sir. I've gone to the literature in a patient of GI infection, especially in the practice, reappearance of vomiting. I'm saying reappearance of vomiting, one of the commonest cause is a combination of norflox metronidazole prescribed or oflox metronidazole prescribed. Or the combination cause of reappearance of vomiting, not other combination of GI infection. This I right literature correct hai ka hai? This bolto hai.
Yes, Dr. Jay, I agree with you. See, let me tell you one thing. As Dr. Baldev sir has said, there is no rationale in combining these antibiotics. First and foremost thing, norfloxacin being a quinolone is not indicated below the age of 12 years because it is not. We are not permitted to use it. Combining with metronidazole, if you look at the combinations available, it is irrational because it contains the combination of norfloxacin 100 and metronidazole 100. Even if I were to use these two antimicrobials individually, the doses are going to be different. Right. So ideally, if at all, there has to be some combination. Metro should have been 200. So what I'm trying to say is that these combinations may appear convenient to the patient, but in a reality, you are giving or you are exposing the child to a wrong dose. And as sir mentioned, there are only two indications. Don't do a stool test, clinical examination. If a child has high fever, crampy abdominal pain, loose motions with streaks of blood, it is bacillary dysentery. And that is perhaps the only indication where oral cefixime would be the first choice.
Thank you, sir. So what are the other antibiotics can we use alternative in this the bacillary dysentery?
Another alternative antibiotic can be cotramaxazole, which can be used. Or suppose in such a situation, if there is some problem in accepting oral medications, one can think of using an aminoglycoside, but that would be a very rare situation. But cotramaxazole can be used sometimes. And besides that, I think other cephalosporins can be used, but I think most of the time cefixime suffices.
Okay, thank you. So moving ahead with the last second question for the team macro lead. Are you ready, Rajesh ji?
Yes, sir.
Yes, a 6-year-old boy brought with fever, purulent nasal discharge, diagnosis of bacterial rhinosinusitis. What is the dose of and duration of treatment with azithromycin? I will come back to expert later, but your time starts now.
10 mg per kg body weight for 5 days.
10 mg per kg per day for 5 days.
5 days.
5 to 7 days, sorry.
Okay, I have registered the answer. Dose of azithromycin. Yes, please put the answer, Hemanji. 10 mg per kg first day, followed by 5 mg per kg per day, once for 4 days. Is actually dose of azithromycin. Not 10 mg per kg per day for 5 days, right? So I go back to our both expert. Is I am right to start a bacterial rhinosinusitis patient or direct azithromycin? Any other drug can be tried in this patient?
No, I think you should not use azithromycin as a first choice here. Your drug of choice should be amoxicillin. Because if you look at the spectrum of bacteria which are responsible for causing bacterial sinusitis, they are mostly only 3. It can be either Streptococcus pneumoniae, it can be either H. influenzae, or it can be Moraxella catarrhalis. And the best antibiotic to work against all of them is probably amoxicillin. At the most, if amoxicillin is not effective, you can think of going for amoxiclav. But again, a 6-year-old boy, fever, purulent nasal discharge, I think your choice should never be azithromycin in first place. That is my opinion. Baldev sir, please comment.
Absolutely right. I think only the amoxicillin, no choice. Even though I will not go for amoxiclav also because 6 years old child. Younger the child, I may think for that. Otherwise, the amoxicillin is the good answer. And azithromycin somehow, it is absolutely wrongly and improperly used. I think the very clear message should go. Just only I would like to give the message that whenever you want to give the antibiotics, ask the questions to yourself. What you want to treat, which organism, and for that organism which is the drug of the choice. I am sure that if you ask these questions, your choice will be appropriate. As very rightly Dr. Chant mentioned, that organisms which he enumerated for the bacterial sinusitis, I think there is no place to the azithromycin. And amoxicillin works in most of these what are responsible for the bacterial sinusitis.
Right.
And I'm sure that that thought process should be that which will help
Yes.
us.
So, sir, just putting this question on the diocese, we should have a discussion about the azithromycin because it's a left-right use in the practice. When
Yeah.
Because it kept as a result for tuberculosis also, right? Right.
And even please remember, even in the sensitive organisms which were there in the past to the azithromycin, more than 40% have been reported as resistant now. So I think if at all even it is indicated, probably it may not work in 40%. That's why also it is probably, it should not be of choice.
Sir, it may be once a day it is used. That's why the doctors are using more. Amoxicillin is to be given thrice a day. One of the reason.
I think very simple, in our practice, we are trying to find out the simplest ways. This is only once a day, maximum 5 days. So it becomes easy for the patient to accept. I think these are the things. But
Absolutely. I agree, sir. Right, sir. I agree, sir.
Okay. So,
So Dr. Jay, if it is misused also, we are interested for the dose. The dose has been wrongly set, so we will not give the points.
Yeah.
So, sir, what, sir? Sir, 10 mg per kg per day for 5 days. What is the wrong?
First day 10.
First day, taking later on 5 grams per kg per day. Right. Go refer to exercise.
Sir, it is not asked. It is what should be first day dose and what should be 4 days.
When you ask the question of antibiotic duration, milligram, to perfect is mentioned by the show. There is no argument.
It is not asked. It is not asked, sir. It is not asked.
No argument. Quiz master decision is final. You are moving on the third question.
It is not asked, sir.
You are going again the third question. Are you ready for third question?
Dr. Rajesh, just for a moment, take it, I would say, sportsmanship, and final decision should be of the quiz master.
Yeah.
Even not the expert. The quiz master is the final person.
Yes.
Okay.
Okay. No issue.
Question third. On the dice, please. Hemanji. What is meant by antibiotic resistance? Option A, it means our body has become resistant to the antibiotic. Option 2, it means the bacteria have developed antibiotic resistance. C, both A and B. D, none of above. Your time starts now.
C, A and B. Sorry.
B फक्त B, Rajesh.
B for the B only. B. It means bacteria have developed antibiotic resistance.
I already said the rule. When the first answer comes from the team leader, he said option A and B both. Right, Rajesh?
Hey, Jay, in the time he corrected.
नाही करेक्टेड पण आपला जो रूल आहे रूल मध्ये फर्स्ट आन्सर टीम लीडरनी दिल्यानंतर वी आर टेकन दॅट आन्सर ओनली. यू कॅनॉट गो बॅक. अदर टीम लीडर दिला तर ते घेऊ शकतो. टीम लीडरने पहिला जर आन्सर डायरेक्ट दिलं राईट. सो
I was discussing with sir.
No, you are not discussing.
Dr. Rajesh only say unfortunate.
Yes. And I can say your thought process was correct. Confused आणि हा क्वेश्चन ट्रिकी होता. त्याला ए आणि बी उत्तर मला मिळणं अपेक्षित होतं. दॅट इज करेक्ट. You answered it, but it is a wrong answer. And sorry for that. Scorer, please note, we are not giving marks for this question. Yeah, so it means the bacteria have developed resistance to the antibiotic. The body has not become resistant to the antibiotic. So thank you, team Macrolide. What they have scored?
Macrolides have answered only one question.
One question.
So they have scored
Okay.
10.
Yeah. So thank you, team Macrolide. You are going at the team Kilo Loan. Are you ready? Team Kilo Loan Vidarva. कोण आहे टीम लीडर कोण आहेत? All please present. Acknowledge your presence.
Yes, sir, from Vidarbha present.
Who is the team leader? Dr. Sanjana, तुम्ही team leader आहात?
Dr. Deepak Raipure.
Who is going to answer? To whom I am going to concentrate? टीम लीडर ठरवा पटकन. You can discuss and discuss and team leader will confirm the answer.
Brajesh sir, Brajesh Prajapati sir, will you take up?
Okay.
Dr. Jay and other team, I will just inform you, please decide among yourself, but whenever you answer, now you just ask, start the answer by quiz master, my final answer is this. Otherwise, then before we had a confusion. So don't create confusion. If you want to discuss among self, but come out with a decide who is going to answer.
Yes, sir.
Who is team leader now?
Brajesh Prajapati sir.
Okay, I will. Dr. Brajesh is the captain of you. अचानक resign केल्यामुळे त्यांना captain करण्यात आलेलं आहे असं वाटतं मला. पण ठीक आहे. So team Kunolon, this is a question 1 for you on the screen. 1 year old brought with complaints of loose motions, watery and vomiting, mild fever, and history of bottle feeding, and dehydration is moderate. Your treatment options are option A, syrup O2, ORS, ondansetron syrup. Option B, ORS, zinc, ondansetron syrup, paracetamol. Option C, syrup cefaxime, ORS. And option D, syrup metronidazole and no breastfeeding. Your time starts now.
Sir, answer is B.
Answer is B for?
B for Brajesh.
Okay, B for Brajesh. So, team leader has confirmed the answer B, that is ORS, syrup zinc, ondansetron, syrup paracetamol. Please confirm my answer, Dr. Hemant. Yeah, so perfectly right. बलदेव सर, लेकिन ये पेशेंट को तो थोड़ा माइल्ड फीवर है, इतना डिहाइड्रेशन है, मॉडरेट है, मुझे तो एंटीबायोटिक्स को तो देना पड़ेगा सिफिक्सिम. ऐसे कैसे रिकवर होगा ये पेशेंट? 1 year old है, बॉटल फीड है सर, कैसा करेंगे हम उसको? तो मुझे
again look at the patient problem in the examination. Loose motions, watery. Label it is the always acute diarrheal disorder. Once you say acute diarrheal disorders, most of the times it is viral, even in the presence of bottle feeding. But still, suppose bottle feeding is responsible for infection or something, you can start the treatment, wait even if necessary, you can investigate and confirm. But straight away, antibiotics are not indicated. And for that purpose, naturally, best treatment is the ORS and syrup zinc. Somehow, when I don't go for the ondansetron also, but somebody has given, it's not wrong. And paracetamol, of course, for the fever. It's the right answer. I think beyond that, nothing else is required in this situation.
Okay,
thank you. I think the last, no breastfeeding is the crime. I think we no breastfeeding for what purpose? In any circumstances, I think even in approved transient lactose intolerance, please don't stop the breastfeeding. On the contrary, breastfeeding works for, I will say, your line of the treatment, whatever you offer. It's very important. In any circumstances, don't stop the breastfeeding.
सर लेकिन ये ग्रैंडफादर ग्रैंडमदर कोई बोलता है कि पहले दूध बंद कर दो, डायरिया होता है तो.
Yeah, that's why we'll have to take some time and to explain them.
Right.
And particularly when the question comes of breastfeeding, I think then there is no even they will be very easily convinced. Probably top male convincing may be the difficulty, but breastfeeding very easily they accept it.
So thank you, sir. It's a case of viral gastroenteritis with moderate dehydration and no antibiotic, only ORS and zinc and SS paracetamol and ondansetron. Thank you, Risha. Moving on to the second question. Are you ready, team? The 5-year-old brought with complaints of fevers in 7 days, examination febrile, vital stable, liver and spleen both are palpable. Diagnosis the enteric fever. So what is the dose and duration of cefaxime in pediatrics? Your time starts now.
20 mg per kg for 14 days.
Team leader.
Yes, sir. 50 mg per kg, sir.
14 days, right, sir?
Dose, please. 15 mg.
Sir, 8 mg per kg per dose.
20 mg for the enteric.
Team leader, please confirm again.
Yes, ma'am.
It's
I heard
20
that
mg.
team leader saying 8 milligram per kg per day.
No, 20, sir. 20. Brajesh sir said 20, sir. 20 mg per kg
20
per day for 14
mg,
days.
yes, sir. I go for 20 mg per kg.
The rule is, I always said, when you answer the first question, first answer comes 8 milligram per kg per day, right? I to take that answer, right? You
No,
are.
sir. He said 20, sir.
Who is the team
Hey,
leader?
madam.
नाही.
जय सर मॅडम आधी 20 बोलल्या
हा
होत्या
20 जय 20 जय
Okay,
20 बोला.
okay. Team leader कोण आहेत?
नाही, पण ते डिस्कस करत होते ना त्यांचं काहीतरी ते.
It's okay. Okay, I will take. So dose is so. Please put the answer on the board. So dose is 20 mg per kg per day divided in 2 doses for 12 to 14 days. So the answer is correct. Scorer, please note. They have given the correct answer. So moving on with the third question for the team quinolones. What type of side effects is most commonly observed in beta-lactam antibiotics? A. Hearing loss. B. Aplastic anemia. C. Allergic reaction. And D. Yellowing of the teeth. Your time starts now.
Please suggest, ma'am.
Sir, I think mostly allergic reaction, sir. You can go for allergic reaction, sir.
Okay, allergic reaction.
Okay, team leader have confirmed the answer. Allergic reaction. Let us confirm the board from our quiz bank. So perfectly right. So allergic reaction is the most common side effect of beta-lactam antibiotics, right? So where our expert Jain Joshi sir.
Which are the beta-lactam antibiotics experts?
आपण नंतर बघू ते. We are running out the time. So
Yes.
Yeah, I think the answer is correct. Hearing loss is mainly attributed to aminoglycosides.
Yeah.
Aplastic anemia is commonly seen after medicines like chloromycetin, and yellowing of teeth is a common side effect of tetracycline, which anyway is not recommended below the age of 12 years.
Okay.
So eliminating that, allergic reactions, the most common of beta-lactam antibiotics. Beta-lactam is a wide group, but I think most of them are used as a derivative. But even the allergic reactions are not very common. They can be sometimes seen in some individuals. Thank you.
Thank you. So
Just a word for the beta-lactam, what Dr. Hemant asked the question. Beta-lactam is the chemically ring.
Right.
There is a chemical substance. And with this ring, which antibiotics are included, there are the cephalosporins, even the ampicillin, amoxicillin group, and the penicillin. All are these beta-lactam groups.
Okay, sir. Thank you. So scorer, please, team quinolones.
Rahul,
what is score of them?
come on, like
Team quinolones have answered all the three right, and they get 30 round one.
So congratulations. Please, the next is beta-lactam team. Please, other team, keep video and audio off. Are
yes,
you
sir, they are all
ready?
available.
Who is the team leader?
Dr. Pankaj, yes, sir.
Okay, Dr.
Pankaj Palve.
पंकज पालवे तुमचा
पंकज सर डिस्कस केल्यानंतर आन्सर द्या.
ऑल द बेस्ट.
एक मिनिट, पंकज पालवे कोण आहेत? हात वर करा. कुठे? हात वर करा. तुम्ही अविनाश भोसले कोण आहेत तिथे? त्यांचं रिनेम करायला पाहिजे ना तुम्ही, गडबड होती. ठीक आहे, राईट. ओके. सो हिअर द फर्स्ट क्वेश्चन फॉर यू ऑन द स्क्रीन. 5-year-old boy brought with complaint of fever one day, common cold, pain in ear. Treatment options are tablet amoxicillin ibuprofen, option B tablet ibuprofen, decongestant syrup and follow up, and option C tablet clarithromycin, tablet paracetamol, and option D is tablet ciprofloxacin and tablet paracetamol. Your time starts now.
Sir, A. The answer is B, sir.
सर ए.
Who is team leader?
Myself, Dr. Pankaj.
तुमचा आन्सर काय आहे?
B.
B. Okay. So I registered the answer B, that is tablet ibuprofen and decongestant and follow up. Let us confirm the answer. Bingo, you are perfectly right. So this patient was Baldev sir. I'm coming back to you. 5-year-old with pain in ear, right? Otitis media sir, patient deaf हो जाएगा बाद में उसका tympanic membrane फट के, तो एंटीबायोटिक देना चाहिए. I want patient and 10 दिन का मुझे 100 mg per kg देना ही चाहिए एंटीबायोटिक्स को.
I think before that, let me add one point on examination. Go for always otoscopy of the ears.
Yeah.
Somehow, I think it is not with us in the pediatric practice. Just if you start to use this otoscopy, you learn that what problems are seen in the ears and you can diagnose otitis media. Now the question, younger the child, less than 2 years, and is this patient is having this the picture, that the fever, high grade, irritability, and even pulling the ears, and suppose if you examine, I think here the amoxicillin should be given. But the 5-year-old child, even 2 to 3 years is also dilemma. But when the child is 5 years, I think it is very clear cut. Just it's a simple, in fact, viral infection or so. And here already it is common cold is there. So simply symptomatic therapy is more than sufficient. Antibiotics are not indicated in this age group of the children.
Okay, sir. Point well taken. We're moving on to the second question for the team beta.
Dr. Jay. Yes, sir.
Yes,
Dr.
sir.
Jay.
Huh.
Yes, I would have just suggested one more modification to the previous question. That was it the pain in one ear or both ears?
Sir, एकाच कानात आहे असं म्हणेल सध्या मी.
So if it is a unilateral ear pain, then probably, as Dr. Baldev sir said, unilaterality and the age more than 2 years, one can wait, hold on to give an antibiotic and observe the child. Because more often than not, it is because of the nose block that you get an ear block and a sensation of pain. Okay. Yeah. And as sir said, otoscopy is an important thing which one must follow. Everyone must follow.
Okay. Correct. Point well taken.
Yeah.
So
Thank you.
3 years, pain, unilateral or bilateral, only decongestant and wait and watch, and otoscopy should be used. Thank you. So question 2 for the team beta lactam. 4-year-old brought with loose motion, blood and mucus, pain abdomen, clinically diagnosed as amoebic dysentery. ठीक है, ये पेशेंट को मैं amoebic dysentery. So what is the dose and duration of oral metronidazole in this patient? The time starts now.
Sir, 30 mg per kg per day for 7 days.
40 milligram per kg per day for 10 days.
Okay, so I heard the team leaders answering 40 mg per kg per day for 10 days, right? Na?
Thrice a day.
Thrice a day. Okay, 40 mg per kg per day for thrice a day. Okay, what is the answer? Let us confirm. Dosage 20 to 30 mg per kg per day divided into 3 doses for 7 days. So this is the answer. Let us go to the Baldev Pradhan sir, our expert.
I think I would here, this is the condition where I would have to go for the stool examination.
Right.
And examine the trophocytes of Entavier histotica. Then probably I will go for metronidazole. Otherwise, even in this picture also I will wait. The reason, in many times it may be simple due to some food or so, and that may settle down in a day or two. But really, if you go for stool examination and if you get the trophocytes of Entavier, then I think the metronidazole dose and for 7 days is right.
सर देखो कंफर्म है, स्टूल एग्जाम किया था मैंने, बताया नहीं, लेकिन अभी डिसेंट्री है तो 40 mg per kg per day divided 10 days ये ले सकते हैं, आंसर नहीं ले सकते.
This dose and days duration is right. 20 to 30 and 7 days.
Dr. Jay, I think that sentence needs to be corrected. Clinically diagnosed as amoebic dysentery.
It's okay.
What sir was trying to highlight was here you should do a stool examination to confirm the presence of trophocytes.
Right.
Thank you.
I have the question.
Hello.
Hello, sir.
Yeah.
I have the question. So, amoebic dysentery, when we prescribe metronidazole, within 5 days, after more than 5 days, the patient complains of vomiting. The side effect of vomiting after 5 days course.
You are absolutely right. Metronidazole does have a side effect profile, and one of them is metallic taste, nausea, and vomiting. But
yes, sir.
I think Dr. Baldev sir is also there. I would like to share my experiences that whenever you prescribe an antibiotic or an antibacterial or antimicrobial for that matter, my experience is that if your diagnosis is correct, more often than not, you will not have any side effects. I think the patients would probably have side effects more if probably you have started the treatment in doubt. So if you have a confirmation and if you give proper instructions, like you should try and give it around the meals time, you should try and avoid for that period, maybe you can avoid giving milk, or if the child is vomiting continuously, and you have to instruct the parents. As you rightly said, there is a side effect profile for metronidazole orally, and that's why it is not a very preferred choice. But if it is an amoebic dysentery, there is no other alternative. So yes, it is. There is a possibility you can cover it up by giving some oral antibiotic like metoclopramide, like Reglan, or sometimes even ondansetron if the vomiting is too severe.
Okay, thank you, sir. Moving ahead with the.
Jay, whether to give right or wrong, 20 to 13, 40.
That's right. Scorer, please give the 10 marks.
Thank you.
Noted.
Okay, we are moving ahead with the third question. Please move ahead. Hemant Gangule, sir, we are coming late. So, which of the following antibiotics is effective in treating oral candidiasis? A. Nystatin, bacitracin, terbinafine, or gizofulvin? Your time starts now.
Rahul?
Rahul sir.
हॅलो
Team
कन्फ्युजन आहे बॅसिट्रॅसिन वाटतंय ऑप्शन बी
C. Terbinafine. You are saying? Okay. Let us confirm the answer with the question bank. So we actually apply this oral nystatin to the oral application for the common this oral thrush or candidates we get in the pediatric patient. So we are moving scorer.
Oral.
Yes.
How much they have scored?
The
At
beta
the end of
lactams.
first round.
Yeah, beta lactams are scored 20. So at the end of the first round, penicillins are at 20, cephalosporins at 30, macrolides at 10, quinolones at 30, and beta lactams at 20.
Okay. So now we are moving ahead with the round 2. Kone peri round 2 sati?
Dr. Jay, little bit fast and experts to say in brief.
Yeah. Team penicillin, are you ready? Team penicillin, team leader. Are you there? Marathwada team?
Penicillin Marathwada team.
Yes, sir.
Yes. Other, please, video audio off. Question first for you on the screen. A 2-year-old boy, child brought the history of convulsions 1 hour back, fever since 1 day, common cold. On examination, mild fever, watery nasal discharge, system examination, CNS active alert, no signs of raised acidity or mean irritation, and other system examination within normal limit. The treatment options are A. Syrup paracetamol, syrup cephalosporin, admit CSF examination. Third, counseling, syrup paracetamol, midazolam nasal spray. And fourth option, D, is injection diazepam, oral anticonvulsants for the 2 years. Your time starts now. Unmute करा दीपक तुम्हाला. तुम्ही म्यूट आहात. हां.
C, sir. Answer is C. Counseling, syrup paracetamol, midazolam nasal spray.
Okay. So let us confirm your answer.
Yes, sir.
Yeah. Dr. Hemant, yes, you're perfectly right. It's a case of febrile convulsions and 2-year-old and improved even after convulsions. Patient is clinically absolutely normal. So these are the best option. So expert want to say something?
No, I think it's all right. Febrile convulsion.
Okay. We'll discuss with time is there. So to question 2 for the team.
Dr. Jay, if experts want to say 1 or 2, them take-home message can say yes in brief. Huh? Okay.
No, I think it's a very clear-cut febrile seizures. And once you see febrile seizure, I think this is the correct answer.
Okay. Yeah. Thank you. Picture on the dice for you, Hemant sir. And you have to diagnose this case. Your time starts now. Throat examination है. Team leader.
Unmute करो.
Yes, sir. Bacterial tonsillitis.
Okay. Let us see. Exudative congestion आहे. बघूयात काय आहे. Yes, you're perfectly right. It is a bacterial tonsillitis. We discussed a lot previously. So moving ahead to the third question for the team penicillin. Which of the following is not a antibiotics misuse? Which is of following is not an antibiotic misuse? Option A, prescribing antibiotics for common cold, finishing full regime, using outdated antibiotics. Option C, using antibiotics in animal feeds. Your time starts now.
Yes, sir. Finishing full regimen. B is answer.
So team leader already bombarded the option B, right?
Yes.
Finishing full regime. So let us confirm. आम्हाला वाट बघावं लागेल 15 सेकंद संपेपर्यंत. So they are well studied, bang on, critical questions. So they are perfectly right. You are said the finishing full regime are not an antibiotics, but others are the antibiotic misuse. Scorer, please. They have scored 10 marks in this. What is the score?
Yeah, they have scored 30 in round 2. Penicillins.
Okay, thank you. Team Penicillin are moving on the team Cephalosporin. Team ready, Cephalosporin. Team West Maharashtra, Western Maharashtra. Team leader Priya Madam आहेत. शेवाळे सर आहेत का?
आणि डॉक्टर मनीषा.
Manisha, are you ready, sir?
Yes. Ready.
The question first on the screen for you. 7-year-old boy brought with complaints of fever 4 to 5 days, rash over body, vomiting, weakness, pain in abdomen, a febrile, heart rate 120 per minute, RR 29 per minute, cyst examination, heart sound normal, no murmur, raised cyst examination within normal limit, and blood pressure somewhat maybe on lower side. Investigation, dengue, IgG positive. What are the treatment options? Option A, tablet ciprofloxacin, tablet paracetamol. Option B, tablet cefixime, paracetamol, syrup cyclopam. And option C, refer to higher center for further treatment. And D, tablet ondansetron, syrup colicade. Your time starts now.
C.
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 Team leader?
C.
C for
C,
cat?
refer to
C, sir.
C for cat.
C, refer
To higher center.
Okay. So I have registered that answer. Let us confirm that answer with question bank. Yes, you are perfectly right. Baldev sir.
Yeah, I think always it's once you diagnose dengue, dengue is the clinical diagnosis.
Right.
And
yes,
after that, categorize either the dengue fever without problem or dengue fever with these warning signs or with the complications. Or severe dengue, what we say. Now here, if you say the 7 years old child, afebrile but now tachycardia, and you said the blood pressure lower side, it indicates that the leaking has started. And then at any time patient can go in the shock. So I think if you don't have this sufficient facility to tackle this situation of the shock, wise step is to refer the patient at proper place.
Thank you, sir. So that's
and that's a just message. In dengue fever, always categorize the patient. Right. According to the category, that will give you the idea. And even suppose if you are treating outdoor patient, talk to the parents regarding the warning signs, so that by chance if it develops, they will come back.
Right. So point perfected, red flag signs are there. This patient must be referred to the higher center where the facilities are available. So question 2 for teams. Yes, the picture for you. We have to give the diagnosis for this patient. Your time starts now. Team leader.
herpes simplex.
Okay, I have heard the answer herpes simplex from the Priya Wagay madam. She is the team leader, right? Thank you, madam, for immediate answering. So let us confirm the answer. it is impetigo. Basically, somebody has to, you must discuss with your team mates and decide. So thank you very much. So moving on to the third question for the team cephalosporin. Which of the following is not a way to prevent antibiotics resistance? Using broad spectrum antibiotic, always finishing full regime of antibiotic, not using leftover antibiotics, avoiding unnecessary prescriptions. Your time starts now. Yeah, madam.
Using broad spectrum antibiotics.
Okay, I heard registered the answer. I think you're perfectly right. Let's just confirm. So using broad spectrum antibiotics are not a way to prevent antibiotics, but the other are perfectly right. So we're moving ahead with the third team now. Thank you, Team Cephalosporin. How much they scored? Scorer, madam?
Yeah, cephalosporins have scored 20.
Okay, thank you. The team macrolide, M for Mumbai, M for macrolide. Are you ready, Rajesh?
Yes, sir. Yes, sir.
Okay, team first question first for on the screen.
Other participants. Other participants.
राजेश डायरेक्ट उत्तर देऊ नको.
Other participants, please help.
राजेश डायरेक्ट उत्तर देऊ नको.
Yeah, I am concentrating on the team leader. Question first. A 1-month-old infant brought with complaint of fever since 3 days. Decrease intake of feed. On examination, afebrile, heart rate 150 per minute, 16 examination within normal limit. The treatment options are option A, paracetamol amoxicillin drops, option B, injection ceftriaxone IM, paracetamol drops, C, refer to admission for an investigation, and D, paracetamol drops only. Your time starts now.
Colleagues.
D. Raja.
No.
Rajesh.
I think C. I think C.
No.
Team leader, Rajesh ji.
Sir, it is C, refer to admission and investigation.
Okay, I will register the answer. Let us confirm. Yes, बलदेव सर 1 month old है, इतना बेबी एकदम स्टेबल है, मस्त फीडिंग ले रहा है, एक्टिव लग रहा है, हाँ थोड़ा फीडिंग कम ले रहा है, कम ले रहा है, लेकिन तो उसको इंजेक्शन सेफ्ट्राक्सोन आईएम दे सकते ना सर? क्यों रेफर करते हैं उसको?
Please remember that once the neonate, it's a 1 month neonate. Neonate sick looking child, probably everybody will agree that it's a serious child, and parents should be ready, treating person be ready for hospitalization and management. When the baby is febrile, but the well looking, this confusion arises, which all the options we are given. But well maybe even the febrile neonate, even the well looking, don't take this any option. The reason is about 30% babies will be having the occult bacteremia.
Right.
And at any time they will go for fast deterioration and very high, I would say, morbidity and even the mortality.
Right.
Therefore, it is not acceptable. Therefore, straight away in the neonate, febrile neonate, even the well looking, we'll have to go for hospitalization. Absolutely all the investigations for sepsis, including even the lumbar puncture, and then start the antibiotics. Here we will not wait. We will start this even the gram positive, gram negative coverage, and therefore cefotaxime and this aminoglycoside. Later on, when you get the reports, suppose by chance if it is simple dehydration fever, you can stop it.
Right.
Or suppose if it just you get the malaria, stop the antibiotics and start the anti-malarials. But the point is, looking at the very fast deterioration and the high mortality, we cannot wait. Hospitalization, go for investigations, including even the cultures and the CSF, and accordingly start the antibiotics. Later on, as per your report and looking at the baby, you can go for the modification. Number 2, therefore only paracetamol we cannot wait. Paracetamol, oral amoxicillin, any oral antibiotics in neonate has no role. Either if it is indicated or not. If indicated, then parenteral also intravenous, not intramuscular.
Right.
Therefore, it is very clear message. Newborns, if the antibiotics are required, parenteral intravenous or no antibiotics, oral has no role. And as I said, this is the approach for the bad-looking newborn, even with the fever, that we should follow.
Thank you, sir. So point well taken. Neonate, just refer. So question 2. Is a picture for you throat examination. What is your clinical diagnosis or looking at the patient's throat? Your time starts now.
You heard it.
Herpangina.
Team leader.
Herpangina.
Sir, I go with Madam Herpangina.
Okay, herpengioma. Okay, let us confirm this answer.
Upper lip ला है बरोबर.
Aha,
Lower lip ला.
perfectly right. Herpengioma is a
Thank you,
perfect
madam.
answer.
Lower lip ला है.
Yeah. Point well taken. Today right. Cracking. Scorer.
Hey, third question.
Third question. Okay, we're going to the third question. One important disadvantage of using broad spectrum antibiotic is A. Destroy normal bacterial flora. Extremely toxic. C option, easily inactivated by the host. And D, target host cells. Your time starts now.
Rajesh, A.
Team leader.
तर तुम्ही क्लॉक स्टार्ट नाही केलं.
हाँ, चालू झालं clock.
I think A, sir.
Anybody else?
A.
Sir, I go with all. Answer is A.
Answer is
Okay, well, log the answer. Let us confirm the answer. Yes, they destroy normal bacterial flora. Perfectly right. Thank you. So, team macro lead, how much they score, madam?
Answered all three right, 30.
Yeah, perfectly. So, team quinolones, Vidarbha, round 2, question 1. Are you ready, Vidarbha, team?
Yes, sir.
Team leader?
Yes, sir.
Yes. Brajesh, sir, are you ready then?
Yes, sir, ready.
Fine. Okay, the question 1 for you. First question. A 6-year-old bought with complaint of fever in 3 days, cough, cold, tremors during fever, heart rate 90 per minute, RR 26, 16 examination within normal limit, RT-PCR positive. Grandfather died 7 days back due to corona. Treatment options are admission remdesivir, option B home quarantine monitor paracetamol, option C oral fluvier paracetamol, option D tablet Visalon hydroxychloroquine. Your time starts now.
Sir, answer is B. Answer is B. Home quarantine, monitor, paracetamol.
Okay, so I have a leader is confirmed the answer. Answer B, home quarantine and monitor and paracetamol. Okay, let us confirm it. Yeah, perfectly right. बलदेव सर, एक्चुअली पेशेंट को ट्रेमर आ रहा है तो उसको एक्चुअली एडमिट करना चाहिए ना सर, उस पेशेंट को ये कोरोना चालू है, इतने सब लोग डर रहे तो उसका फादर भी एक्सपायर हो चुका है, तो घर पे कैसा रखेंगे उसको सर?
I think we were not knowing anything regarding the COVID initially, but by this time we have learned, and particularly in the pediatric practice, that it is less common, less problem, less complication, less mortality.
Okay.
Most of the times, if at least monitoring is required, by chance some problem, complication develop, few can develop, then you can go, but straight away, all these options are not required.
Okay, thank you, sir. Point well taken. Question 2 for the team quinolones. And this is your diagnosis. Your time starts now.
I think it's Quincy.
Brajesh, sir.
Tonsillitis.
Parapharyngeal abscess.
Pharyngitis.
Brajesh, sir, confirm the answer, please.
Yes, sir, confirm.
Yeah?
Go with.
Go with.
Parapharyngeal, that's an abscess.
And the parapharyngeal abscess.
Brajesh, sir, अभी discussion बंद हो गया. आपका क्या pharyngitis बोला ना आपने?
Yes, yes, sir.
Okay, let us confirm the answer. Pharyngitis आहे का बघूयात आपण.
Quincy.
This was the answer. Sorry, we can't give to you. it should
Sir, we
discuss
were
with
discussing and we said parapharyngeal abscess. No, sir.
मैडम आपके टीम आंसर करना चाहिए, आपने आंसर करी, इसलिए मैंने बोला था आप टीम लीडर हो सकते थे, आपने छोड़ दिया था. थर्ड क्वेश्चन फॉर यू. Bacteria which are resistant to a large number of antibiotics are called. Option A, superbugs. B, mutants. C, MRSA. D, super infections. Your time starts now.
Ma'am, please suggest.
Superbugs, sir.
Superbugs. Yes.
A.
Yes. A, superbugs.
A, superbugs. Let us confirm the answer. Yeah, you're probably superly right this time. So superbugs. Thank you very much. So what is the score now, madam?
Yeah, quinolones have answered 2, right? So there's 420.
Okay, thank you. So thank you, Team Quinolone, Team Beta Lactam. We are moving ahead fast. Team leader, yes, no?
Yes, sir.
Yeah.
Yes.
Team leader now Palve, sir, na?
Yes, Dr.
Okay. हात वर करा एकदा परत एकदा. तुम्ही रिनेम भोसले सरांचं नाव काढून टाकावं त्यातनं तिथून. असं नाही चालत ना. ठीक आहे. Question 1 for you. A 10-year-old boy came with a history of fever, chills, rigors, febrile, vital stable, peridone, liver palpable, spleen palpable, platelets 80,000, Plasmodium vivax positive. The treatment options are option A, tablet chloroquine, B, mefloquine, C, artemether lumefantrine, and D, injection chloroquine IM. Your time starts now.
Rahul?
Sir, C.
Huh?
C na?
C.
Vivax है Vivax.
The option is A, sir. A.
Palve sir.
Option is A.
A. Sorry, sir. A.
A.
Chloroquine.
Acha. Let us confirm the answer. Oh, that is the correct answer. Congratulations. बलदेव सर, लेकिन ये पेशेंट को 80,000 प्लेटेड हो गया है, वाइवैक्स सर उसको क्लोरोक्विन में किधर इफेक्ट करता है सर? मैं तो उसको आर्टेमिथिन लुमेफेंट्रिन देने में ज्यादा है, आई एम दूसरा मेफ्लोक्विन ऐसा कुछ देना चाहता हूँ.
I think go by definition of WHO.
सर बताइए सर क्या रहता है वो?
What is the complicated malaria? What is the simple malaria? P-Vivax malaria with only isolated thrombocytopenia, don't consider it as the complicated malaria. It is simple and works chloroquine. And even the chloroquine injectable, now never use it. Even the parenteral route, intravenous, don't use it. The sudden problem, complications, and even the days have been departed. I remember long back in the government of Gujarat sent one circular that even the small, never give this injectable chloroquine because it was very routine in the practice. So chloroquine parenteral, no. Oral, this Vivax particularly when it is not complicated, and here is the case, so it should be given. Artemether lumefantrine is particularly when the definition comes of complicated malaria. That can be falciparum or with the Vivax also, which is not so common. Mefloquine is not meant for this purpose.
Thank you very much, sir. Point well taken.
But unfortunately, malaria has come down since last few years.
Yes, sir. So we are moving with the question 2 for the team Beta Lactam round 2. The picture for you. Throat examination. What is the diagnosis? Your time starts now.
Pharyngitis.
Pharyngitis.
Palve sir.
Follicular pharyngitis.
Kutla pharyngitis? Pharyngitis?
Follicular pharyngitis.
Follicular pharyngitis. Okay, I noted that answer. Let us confirm this answer. One of the commonest cause that OPD patient attends or OPDs is a viral pharyngitis, not follicular pharyngitis. So only simple congestion of the throat. Sir, barabar hai na ye?
Yeah, there is no follicles. I don't know why the mistake. The follicles are not there at all.
सर ये कितना डिफिकल्ट क्वेश्चन रखा है मैंने, इतना ये थ्रोट एग्जामिनेशन कि हम पेशेंट को दूर से देख के हम उसको एंटीबायोटिक लिख देते हैं, थ्रोट देखते नहीं है, हमारे पास स्पैचुला नहीं है, कुछ नहीं है, टॉर्च नहीं रखते, आ करने बोलते हैं, दे देते हैं, फॉलिकुलर दिखता है हमको तो. थैंक यू वेरी मच. सो मूविंग अहेड विद द थर्ड स्कोरर नोट. no marks for their answer. Question third for antibiotic misuse cannot cause option A serious side effect, antibiotic resistance, impaired mental health, increase cost.
Increase cost.
Your time starts now.
Increase cost, sir. D.
Palve sir.
Answer is D.
So it increase cost. Is the answer is D. Okay. Antibiotics misuse cannot cause increase cost.
Yeah.
ट्रिकी क्वेश्चन है. मैंने सेट किया लेकिन मैं आंसर दे क्वेश्चन बैंक से कंफर्म करता हूँ. सर बताइए. ओके सर ये क्वेश्चन अच्छा है कि नहीं है सर बलदेव सर?
I think it is like the KBC. You will have to understand the question. Rather than putting it in I will say simple form, the question itself is twisted, and therefore you will have to just think.
Okay, thank you. So scorer, they are not scored. So antibiotic misuse can cause serious side effect, antibiotic resistance, increased cost. But impaired mental health होता है सर क्योंकि पैसा जाता है ना खिसे में से तो होता है लेकिन ऐसे नहीं होता है. Okay, thank you very much. Scorer, please. So at the end of second round, final score is, madam.
Okay. At the end of the second round, penicillins have scored 30, cephalosporins are 20, macrolides are 30, quinolones are 20, and beta-lactams are 10.
आता total score सांगा madam 1-2 चा.
Total score, okay. Penicillins for the round 1 and round 2 is 50, cephalosporins are at 50, macrolides are at 40, quinolones at 50, and beta-lactams at 30.
Okay. So let us go ahead with the rapid fire round. Are you ready? Round 3. Team कुठे पहिली team? Penicillin team. Are you ready?
Yes, sir. Yes, sir.
बाकी व्हिडिओ ऑडिओ ऑफ करा आणि तुमच्यातला एक जण.
Dr. Jay, 1 minute. Dr. Jay, you explain all the rules and regulations. I will just come within 1 minute. And if Amol, if any of the office bearers of Maha IAP, anyone to comment for 1 or 2 minutes, you can take up. Dr. Amol Power. I cannot see anybody. So any guest is there, anyone is there, you can just ask them to comment on this for a minute or 2 minutes. And then you come to round 3.
Dr. Anjali Kokan, Madam, President of IAP Palghar, please come in. Anjali, Madam.
Excellent initiative. What a wonderful way to learn. And with all that music, it sounds as if Amitabh Bachchan is there in Jai Bhandarkar's hot seat. And all teams are doing extremely well. And I liked Dr. Priya's all-women's team. They're doing extremely well. Very well conducted. Thank you so much.
Dr. Pankaj Agrawal. Snehal Nagre sir. Bola. Hingoli.
Thank you, Amol. It's a wonderful quiz by private practitioners. It is the 3 teams are at 50 on 50 marks, so it will be a great contest in this last round. So best of luck to all the participants. Marathwada is really a wonderful region, and will rock. Best of luck.
Thank you.
Hello.
Thank you, Snehal sir.
Sir,
Dr.
it is a
Pankaj
very
Agrawal.
wonderful quiz. Sir, it is a wonderful quiz, and Jay Bhandarkar sir can replace Amitabh Bachchan in Kaun Banega Crorepati also. He is conducting it very well. Thank you, sir.
Thank you very much.
Oh, महापेडिकॉन में एक घंटे का क्विज लगा देंगे बाबा. Dr. Avinash Bhosle, please comment.
Hello.
Avinash, unmute.
The quiz.
नाही तुम्ही जवळजवळ असेल तर नाही होणार ते.
अविनाश तुम्ही सगळे पार्टिसिपंट घेऊन बसलात त्याच्यामुळे इको यायला लागलाय.
ठीक आहे बलदेव सर अजून कोणी आहे का सिनियर? इफ दे वांट टू स्पीक दे कॅन स्पीक. सो आपले क्वेश्चन बँकर येतीलच.
डॉक्टर नेहा सिंह, डॉक्टर नेहा सिंह फ्रॉम रायगढ़.
हाँ नेहा मैडम, हमारी मीडिया पर्सन कुछ बोलिए. गेल्या दिसते. ठीक है. डॉक्टर हेमंत.
Great going, sir. Please continue, sir.
Okay. So Hemant is there, our question bank. So rapid fire, I will explain the rules. 1 minute, 60 seconds, 6 questions, and only one person will answer. You can discuss. Team leader, Dr. Deepak, तुम्ही करणार answer?
Yes, sir.
And most important, who have to say pass. Unless and you say the pass, I will not ask the next question. You have to answer something or say pass.
Yes, sir.
Everybody understood? So, are you ready? Team Penicillin, Marathon team.
Dr. Jay, before you start, we acknowledge Dr. Neha Singh doing wonderful work with the all flyers and matters. And another person who is behind the screen, Dr. Vishal Rao. If I ask him to speak, still he will not come. Still he will not make his video on. But he is the person who is all the techno wizard for us, for our Maha IAP throughout the year. And all these people have done wonderful work. I think so. Dr. Vishal is there. Thank you, Dr. Vishal, for your contributions. विशाल तुला म्हणायचं असेल एक लाईन.
थँक्यू नेहा.
Dr. Vishal makes wonderful flyers. Whatever the flyers you are seeing throughout the year, it is from Dr. Vishal. Thank you, Dr. Vishal. And with that, yes, Dr. Jay, we will start.
Yes,
and before Jay starts, penicillin is 50, cephalosporin is 50, quinolone is also 50. So 3 teams are on 50. Macrolides is 40 and beta-lactams are 30. So this is a chance to get ahead of one of each other. So yes, Jay.
Yes. So team Penicillin, are you ready? Yes. Yeah. So your rapid fire starts now. I already said you have to say pass or answer something.
Penicillin team is ready. Are you able to see them? All are there?
Yes, sir. Yes, sir.
Just confirm. Yes. So decide who is going to answer.
Myself, sir, Dr. Deepak More.
Okay.
So, yeah.
Please start.
Jay, you should say start.
Start. Please start. Start. Do not start antibiotics without clinical evidence of bacterial infection. True or false?
True.
Unnecessary or inappropriate antibiotics prescribing increases the emergence and spread of resistance bacteria. True or false?
True, sir. True.
Can we use aspirin pediatric patients as an antipyretic?
No.
In anaphylaxis treatment, injection adenine subcut, IM or intramuscular?
Subcut. IM, sir. In pediatric IM, sir.
What is the dose of cephalosporin in bacterial urtia and pediatric milligram per kg?
10 mg per kg.
Okay, let us confirm your answer.
Yes, sir.
Yeah. Hemanji.
One more question is there. Tuberculosis is notifiable disease.
True,
True or false?
True, sir.
होऊन गेलं.
Yes.
True, sir.
Yes. First question.
Sir, 6 question राहिला ना सर.
नाही
झालं आता केलं ना. ट्रू म्हटले ना ते.
ठीक है. Okay. Sorry. चलो. Confirm the answers, please. Do not start antibiotics without any evidence of bacterial infection. True. Yes. There's
answer true.
True. Unnecessary and inappropriate antibiotics prescribing increases the emergence of spread of resistant bacteria. True. They are said true. Can we use aspirin antipyretics? They say
no.
Okay. Reese syndrome का होतो. बरोबर.
We can take. We have to take the answer.
No, but बरोबर है.
Yes.
Okay.
Right. Yes.
In anaphylaxis treatment, injection adenine, they said IM. That's okay. Correct.
Right.
What dose of ceftriaxone bacterial urtia? They said 10 mg per kg in divided doses. We'll take that answer. कारण तेवढंच विचार होता. Correct. Tuberculosis notified disease. True. So I think they have scored all 60 marks. They 60 नहीं.
30.
30 marks. 5 marks for each question है. Oh, congratulations. Cephalosporin.
नाही penicillin now.
नाही हो पेनिसिलिन झाला आता.
हो स्कोर सांगा ना टोटल.
मॅडम स्कोर सांगा. 80.
Yeah, rapid fire. They have scored. They have answered all the questions, right? So they scored 30. And you want the total score?
No, afterwards.
ठीक है.
Well done.
Thank you. Team Sivaras ready. Team leader Deepak Moreji, audio video off करा. Video off करा.
Cephalosporin ना. Dr. Priya madam. Dr. Priya.
Deepak More sir, video off करा. Deepak More sir.
कोण आहे? शिवाळे सर का प्रिया मॅडम कुठे गेल्या?
डॉक्टर प्रिया, डॉक्टर मनीषा, डॉक्टर हेमंत.
चला शिवाळे सर आन्सर करते असं दिसतंय, बाकी कोण दिसत नाहीये. चलो स्टार्ट. रेडी?
बघ ना प्रिया मॅडम आणि आहे का बघा.
नाही येत आता, दिसत नाही तर काय करणार त्याला. चला पटपट घ्या. चला शिवाळे सर करतील बॅटिंग. आल्या मनीषा मॅडम आल्या. कोण करणार आहे आन्सर?
कोण करणार आन्सर?
शिवाळे सरच करतील. चला चलो ठीक आहे सर, चालू करा.
शेवाळे सर. शेवाळे सर
चला. Antibiotics remove the need of surgical or other intervention. True or false?
False.
Many antibiotics only works against certain types of bacteria. True or false?
False.
Azithromycin is used to treat mycoplasma infection. True or false?
False.
What is the oral dose of chloroquine in Vivax malaria? Either say pass or say some answer.
Pass.
What is the typical drug of choice in most of the orofacial infection?
Erythromycin.
Ampicillin is effective against gram-negative bacteria. True or false?
True.
Okay, let us confirm the answer. Himanji. Antibiotics remove the need of surgical intervention. They said
false.
Okay, that is correct. Many antibiotics only works against certain of bacteria. They said false. बरोबर ना शिवाय सर?
Yes.
हाँ. So only one is
false बोलले ना?
हाँ false बोले.
One correction. One is correct till now.
हाँ yes. Next. Azithromycin is used to treat mycoplasma infection. त्यांनी false म्हटलं. Right.
Yes.
हाँ. The true answer. What is the oral dose of chloroquine in Vivax malaria? They are not answered. चलो आगे. What is the typical drug of penicillin orofacial infection? They say erythromycin, but actually it's a penicillin.
Okay.
Last. Ampicillin is effective against gram-negative bacteria. They said
true.
True म्हटले होते का? बरोबर आहे. म्हणजे किती बरोबर आले?
दोन
बरोबर आले. मॅडम नोट डाऊन करा.
दोन.
म्हणजे 10 मार्क. 10 marks. Okay, चलो. Team, next team.
Yes, sir.
Team macro lead, are you ready? Mumbai, Rajesh.
Yes, sir.
Okay. Are you ready? Rules माहित आहेत. 1 minute, 6 questions. Whatever completes first, 5 marks for each question. I have to say answer or say pass. The time starts now. Take appropriate cultures before starting antibiotics. True or false?
True.
If you are taking antibiotics, it's okay to stop taking the medicine when you start to feel better. True or false?
False.
Chloroquine can be used to treat gram-positive bacterial infection. True or false?
False.
What is the minimum bactericidal concentration?
It's 140 to 150.
Okay, I've taken. Next, dose and duration of cefalexin in bacterial pharyngitis.
10 to 15 mg.
10 to 15 mg. ठीक है, okay. Next question. Should we test dose before giving ceftriaxone?
No.
No, okay, ठीक है. So, let us confirm the answer. Take appropriate. पहिला answer बघा.
पहिले बघ ना काय लिहिलंय.
हाँ, take appropriate culture before starting antibiotic. They said false.
True.
True, sir. True. Right. If you are taking antibiotic, it's okay to stop medicine. If you're starting feel better, you said false.
False.
Okay?
Yes.
He said false.
Don't correct. Third, cefixime can be still positive in vaccination. They said false. That is correct. 3 correct. Fourth, what is the minimum dose of bacteria? The minimum blood level of required to kill the bacteria. Their answer is some another thing. These are they are not given correct. Okay. Fourth, fifth, dose and duration of cefalexin pharyngitis 12.5 to 25 mg per kg orally every 12 hours for the 10 days. They said 10 mg per kg.
10 to 15 they said.
10 to 15.
काय करायचं?
10 to 15 बोललेलो सर.
ठीक आहे, we can give it, no problem. So that also correct. Last question. Should we test dose before giving ceftriaxone? They said no.
No.
तर किती करेक्ट आले अमोल?
4
करेक्ट आहे, करेक्ट आहे,
4 करेक्ट आहे,
4 करेक्ट. मॅडम नोट डाऊन करा. दे आर स्कोर 20 मार्क्स. 4 करेक्ट. मॅक्रोलीड. ओके
सर मला 6 क्वेश्चनच डिटेल्स मिळतील का?
अरे
प्रजापती सर, डॉक्टर प्रजापती सर.
काय कुठले?
डॉक्टर प्रजापती सर,
Should we do test dose before giving ceftriaxone?
सर्च करा. आता नाही, अभी डिस्कशन टाइम नाही आहे. आगे नेक्स्ट टीम प्लीज. नेक्स्ट टीम.
वेळ कमी आहे आपल्याकडे त्याच्यामुळे नंतर.
क्विनोलॉन्स टीम क्विनोलॉन्स रेडी? कोण आन्सर करणार आहे? विदर्भ टीम.
मॅडम
Okay, I'll answer.
ओके, संजना मॅडम ने आता टील जिंकले. या ह्याच्यामध्ये राऊंड मध्ये त्या कॅप्टन आहेत. I am relaxed now. Okay. First question. Your time starts now. IV antibiotics should be reviewed on daily basis. True or false?
False.
False. Okay. Antibiotics kill both good and bad bacteria. True or false?
True.
Later generation of cephalosporin have greater gram-negative activity than earlier generation of cephalosporins. True or false?
True, sir.
The patient has acquired an infection while in the hospital. The nurse identified this type of infection as what?
Hospital acquired infection.
How much amoxicillin milligram per year amoxicillin is present in syrup amoxiclav?
There are two, sir. 5 ml has got 200 mg or 5 ml can have even 400 mg. DDS and double strength and that one.
Okay, ठीक है. Name any irrational combination of antidiarrheal drug.
Metronidazole and norfloxacin.
Fantastic. They are, I think, attempted all questions. Let us confirm.
Sir, one late है.
नाही क्वेश्चन सुरू झाला तोच नाही. क्वेश्चन
क्विज मास्टर डिस्कशन करू नका. ऑफ पाहिजे ऑडिओ. विचारल्याशिवाय कोणी बोलायचं नाही. Sorry. IV antibiotics should be reviewed on daily basis. They said true.
Yes.
Right.
Yes.
Correct.
Hey, they said false. They said false.
Acha, false. Okay, not correct. Second. पटपट घ्या पुढचे क्वेश्चन. Antibiotic kill both good or bad bacteria. They said बरोबर आहे.
Right.
Later generation of cephalic have greater gram-negative activity than they said.
Right. True.
Yes.
Okay.
Yes.
Correct. Chautha, the patient has acquired infection while in the hospital, and they say hospital acquired infection, but this type of infection is common infection. Baldev sir, okay, right? ठीक है.
नाही, नोझोकोमियल इन्फेक्शन आहे, हॉस्पिटल अक्वायर्ड त्याला नाही आन्सर, ते रॉंग आहे.
No, yes, sir.
ओके, त्याला रॉंग द्यायचंय. नोझोकोमियल पाहिजे ना.
नोझोकोमियल पाहिजे ना. वर्ड हॉस्पिटल
नाही ना. चालतं ना सर, चालतं.
थांबा. एक्सपर्ट सर, बलदेव सर काय म्हणतात?
जयंत सर, बलदेव सर.
I think hospital acquired nosocomial you can consider almost same.
ठीक है, true.
Yes.
ट्रू देणे
जी.
द्यायचंय मार्क द्यायचंय.
करेक्ट आहे त्यांचं.
हाऊ मच प्रेझेंट 200 or 500 ते बरोबर सांगितलं त्यांनी. 200 that is correct. Sixth
correct.
Norfloxacin, that is 1000 mark for the team Vinolons. Norfloxacin. Actually, they
Five answers are correct.
Okay.
Yes, 5 answers are correct. 25.
25 marks. Okay. Chalo. Scorer लिहिता है madam तुम्ही?
Oh, लिहिते. Noted.
Okay. Thank you. So we're moving with the last part of the last session.
Bias quiz 1000 point देतोय.
1000 points. Yes. Direct. The beta
Dr. Rahul Patil तुमचं म्यूट करा ना. Rahul Patil डॉक्टर म्यूट करा तुमचं.
Okay. Team beta lactam. Team beta lactam. Team leader, please. कौन है team leader?
Myself, Dr. Pankaj.
Dr. Pankaj. Are you ready, sir?
Yes.
Okay.
पंकज अग्रवाल नाही ना, बघून घे.
नाही पंकज दोघं बसलेत ना. बेटा लॅक्टम झालेत आता.
पंकज पालवे.
Yes. Your time starts now.
Yes, चालू. जय बोल.
Time starts now. चालू करा ना तुम्ही. Unnecessary inappropriate antibiotics prescribing increase the emergence of and spread of resistance bacteria. True or false?
True.
All antibiotics are safe to take during pregnancy and breastfeeding. True or false?
False.
Cephalosporin are bactericidal or bacteriostatic?
Bactericidal.
Ceftazidime is the third generation cephalosporin with activity against Pseudomonas. True or false?
True.
Do we need to have basic oxygen available in OPD? Yes or no?
Yes.
Yes.
Can we treat stable neonate with fever on OPD basis on IM ceftriaxone?
No.
No. Team leader?
No.
Okay, let us confirm the answers. Fast. Unnecessary antibiotics is increasing immunity hospital. Yes, they said true, correct. Yes, this also they said false. That is also correct. That is also correct.
Correct. Third is correct.
That also correct.
Correct.
Basic, yes, that is also correct.
ये भी correct है.
ये भी correct है. So I think they are
correct.
Perfectly right. बलदेव सर, ये ओपीडी में ऑक्सीजन का क्या जरूरत है सर? उधर पेशेंट क्या आता है जाता है, उसको पैरासिटामोल लिखते हैं, कुछ तो लिख के देते हैं, क्या क्यों ऑक्सीजन का जरूरत है सर उधर?
I think you should have the area for these tackling the any adverse events following any medicine or even the vaccination. So it is I would say essential that the oxygen facility should be there. Besides that, even other facilities should also be there.
Okay, thank you.
Dr. Jay, that is my answer, my question. In every OPD, oxygen should be there because if any anaphylactic reaction occurs, if any complication occurs, the proper research measures is carried out not to document that oxygen is the essential part of that. And if it is not documented, that becomes a gross negligence of not handling resuscitation in a proper way. So oxygen is a must in every OPD.
Right. We're not going to any medical legal discussion. The Dr. Gangela will take discussion to 2 a.m. in the morning. So thank you very much for all the team for the wonderful सगळे audio video on करा आणि scorer तुम्ही
त्यांना टोटल कॅल्क्युलेशन करू द्या मग ते डिक्लेअर करते.
नाही आय एम रेडी.
You are ready, sir. Ready. Now, आता first and foremost, almost we have done wonderful quizzes last 2 years, and only Sunita Ingre madam was a scorer for the whole time. So I thank her for this, and I give honor to her today now. He declare the final score as well as the winners also.
No, she will declare the scores. And winners and runners will be declared by Dr. Baldev Prajapati sir and Dr. Jain Joshi sir.
Okay, yeah.
So all the teams have excellently played. I know it's a very difficult thing to be in the hot seat trying to answer the questions. So all the teams have done extremely well. Now coming to the scores, penicillins are scored total 80, cephalosporins at 60, macrolides also at 60, and beta-lactams also at 60, and quinolones at 75.
Okay. So who is winner?
Penicillins. Sir, announce kodi karna hai. Penicillins are leading at 80.
Yes.
So should I?
Yes, I think madam should do.
Thank you, sir. So the penicillins are the winner, followed by quinolones who are scored at 75. So That's well done.
So we will request experts to do the official announcement.
Yes.
सर हमारा वीडियो चालू करो सर पेनिसिलिन ग्रुप
पेनिसिलिन हाँ करो सर दीपक सर वीडियो ऑन करो सर आपका
सब लोग ऑन करो वीडियो सब लोग ने ऑन करो
सब लोग ऑन करो
स्टॉप किया
मोरे सर
एवरीबॉडी
करा चालू करा सर दीपक मोरे सर
होस्टने स्टॉप केलाय सर होस्ट कडून तुमच्याकडून स्टॉप केलाय
होस्टने होस्ट त्यांना दाखवा आम्हाला होस्ट कुठे आहेत
होस्ट वाटतं मला वाटतं डॉक्टर नेहा सिंग असतील कारण पल्लवी मॅडम गेल्यात वाटतं
ठीक आहे चलो
Yes. So,
Sir, I have already given them the permission.
Okay. Thank you, madam, very much.
Deepak sir, video on kara. Deepak sir.
Sarvani, video on kara, and we will wait for official announcement by Dr. Baldev Prajapati. The winners of the penicillin and the runners up are the quinonols. So, Dr. Jain Joshi sir and Baldev Prajapati jointly declare penicillin, which is Marathwada, and quinolones is a Vidarbha. Yes, sir. And with your comments, and then we will go to the winner team to ask their comments. So first, Dr. Jain Joshi sir. Unmute kara na.
It gives me great pleasure to announce the results of this fantastic quiz, and the winners are penicillin coming from Marathwada and represented by Dr. Deepak. Heartiest congratulations to all your team, and you have done exceedingly well. And I think Dr. Snehal Nagare will be very happy now and overjoyed if he is still there. So congratulations to Dr. Snehal Nagare also for
thank you, sir.
winning it. And Marathwada is not deprived. Marathwada is rocking.
There is always rocking.
Snehal Nagare sir,
Yes,
you
thank
take
you.
all these things, all these 5 general practitioners to party now.
Yeah, 100%.
And add 10 marks to their 80 marks in that party.
Yeah. Yes. 90 कर देंगे सर आज.
Yes, Dr.
I would request Baldev sir to announce the runner-up, please.
Sir, the advantage of this Marathwada team is they were all 5 together in one room. We were all separate in other places.
Dr. Nagare, 1 minute, please. Let experts say. Dr. Baldev Prajapati sir.
Dr. Ahmad, that is the Quinteron group, runner-up, am I right?
Yes.
Yes, sir.
So already winner group declared, and it is really my great pleasure and honor to declare that this runner-up by Quinteron group. And from which area that Quinteron?
Vidarbha.
Yeah. I think from the history, Vidarbha is known. So from various aspects, and I think still even that team has maintained. So definitely my best compliments and congratulations.
Thank you, sir. Thanks a lot.
Thank you, sir.
Definitely.
So
over to you.
So Dr. Baldev Prajapati sir, with the one question, and then we will go to the comments from all the participants one by one. Sir, what do you feel? What is the after seeing all the quiz? What is our approach of all our general practitioners, general pediatricians?
I think definitely I will appreciate number one, the participation of all the practitioners. You know, to appear as a student is different, and to participate as a practitioner is different. Because, you know, due to the certain reasons, we have so many inhibitions. And I know that even gradually we lose the confidence to ask the question. To that level, the inhibition comes. And here I could see that even the most senior practitioners, they were participating enthusiastically, very actively. And even some of the answers were definitely, I will say, impressive. So my best compliments to all the participants, number one. And even not just participation, but the responses were quick, even the several times right. Now only one my request, that translate all the points in the practice from tomorrow. And please don't keep the hesitation. I am also a practitioner. Please remember, I am not only the medical teacher. I'm teacher, I'm also practicing since almost 38 years. And almost I am trying to follow the principles and I'm not getting the less practice. May not be, I will say, exorbitant, but yes, quite satisfying. So I think that fear should go away from our mind. That is the most common fear, even openly I can discuss. That's the only, I many a times I have seen, and even Ambedkar sir and we have discussed, that probably lack of knowledge is not responsible, maybe responsible to certain extent, but lack of confidence is more responsible in our practice. And I think now with this discussion, we should develop the confidence. And I'm sure that even to some extent, if our practice is modified with a rationality, I'm sure that the purpose is served, Dr. Hemant, Dr.
Yes.
Amol. Then the purpose of the quiz is served. And I'm sure that even the listener, participants, at least some, and if you multiple times participate, automatically some improvement is seen.
Yes.
Tomorrow probably it may happen that it is the viral pharyngitis. Yesterday only I saw that the antibiotic should not be prescribed. So out of at least 5, 7, at least you will not prescribe in few patients. I will say that is also improvement. That is also improvement. So I think that action should be there. That is my main concern. And of course, it's an innovative idea. Just I may take a minute, Dr. Hemant. You know how the quiz came in our Indian Academy of Pediatrics. What is the history of quiz in pediatrics? IAP. For the information to some of my friends and seniors must be aware, in 1987, Indian Academy of Pediatrics, president was my teacher, Dr. Mississippi Desai from Ahmedabad. And during her time, undergraduates had not the separate pediatric subject. So madam thought that how we can attract the students to read the pediatrics and to participate. And she gave that, let us start the undergraduate quiz. And in 87, first quiz was organized in BJ Medical College, Ahmedabad, and I was organizing person. I was junior most assistant professor. 85, I joined as a full-time professor, assistant professor, and I was. And from that time, that still UG quiz is going on. Later on, we started the PG quiz. Even then, this practitioner quiz. And then even we got the ideas that even a specialty branch also we can. And it's I would say, one of the good innovative modality to attract the people for participation, to share the knowledge, even they spread the messages. I think definitely that purpose I could see even in today's this quiz also. So definitely the organizers of the office bearers of the branch, they definitely, I will say, they have this right to take this credit. And particularly, I will say Dr. Hemant, Dr. Amol, and all other names you say that they have participated. And thank you very much, at least for inviting me and giving me this opportunity to be with you. Thank you very much. Over to you, please.
Our pleasure, sir. Our pleasure. We are extremely fortunate to have
you, sir.
And we were together at Udaipur, one of the CME. It was learned lot from you. So
now I will ask Dr. Deepak More, winner of today's quiz, to speak few words. Anyone from Hingoli Marathwada team, please speak.
We feel thankful for Maha Academy of Pediatrics, sir, because they are giving such a opportunity to us to recite our knowledge, and it is wonderful for experience for us. For the first time, we are going to participate in such a noble quiz contest. I am very thankful for all respected sirs, doctors, senior doctors, and especially for Sir Dr. Snehal Nagre sir, because they have promoted us to participate, and without their support, we can't do such like this, sir. Thank you.
Yes. Congratulations, yes, congratulations to you all, and also Snehal Nagre sir, because he has
Sir, one of the person from Hingoli, pediatrician, sir, Dr. Damkonwa, sir, Venkatesh Damkonwa, sir, also promoted us to
help. Yeah, he has given book to you to read and do homework also. Yes.
Thank you, sir.
Next, I will request Sanjana Lal madam Vidarbha team leader
though,
to speak.
though you have answered the questions by reading the book, but it should be implemented in practice.
Yes. But I think gradually it
Sanjana,
happens. It happens.
Yes, sir.
Good
Yes, sir.
evening,
Sanjana,
sir.
ma'am.
Thank you all the respected seniors, Joshi sir and Gongolia sir and Prajapati sir, all for giving this opportunity for us to do it well, represent my area. I'm really happy, sir. Yeah, couldn't win, feeling bad for that. But that's okay, sir. Sir, I said Quincy.
Yes, yes. You said Quincy, but the quiz master's decision
No
was
problem,
final.
sir.
Yes,
Fine,
yes.
fine, fine, sir. No problem. Thank you, sir. Thanks a lot.
I will request Neel Nagre sir to speak few words and then we'll try to conclude. Snell Nagre sir.
सर नहीं है तो नहीं
I will ask Dr. Jayan Joshi sir to speak few words.
Yeah, so I think to conclude, it was my privilege to be amongst all of you, and it was really a great innovative quiz, and really enjoyed that. It is always a pleasure to be in company of Dr. Baldev Prajapati sir. It is always a learning experience when he's around, and you always learn one or two new points. I mean, like, though I have also been in the rational antibiotic practices module for so many years, every time I hear Dr. Baldev bhai, I always learn one or two new things. So thank you very much, sir, for gracing the occasion. Thank you, Dr. Hemant. Thank you, Dr. Amol, for giving me the opportunity to amongst all of us. Dr. Snehal, it was nice catching up with you after a long time. And in the end, I would just humbly request to all of you, those who are all IAP members, to kindly vote for me as I am contesting with the post of Vice President from West Zone. With your blessings and support, I would be able to represent the Maharashtra state in the official board of the Central Respiratory, the Central IAP elections this year. So thank you very much. Thanks once again and good night, everyone.
Dr. Suryakant sir.
Suryakant Pandit sir.
Yeah. It was very interesting one. And what's important is we start knowing more and more the more we attend these lectures. And senior sirs like Dr. Baldev Prajapati, Dr. Joshi were there as experts. We appreciate Dr. Hemant Gangolia who thought of organizing such CME. So it's learning and deleting also. It's very important we delete also what is the old thoughts we have got and remove it from the brain, and learning and de-learning also is important. And this is the interesting quiz, so it makes me better in the practice, clinical practice. Thank you so much, Dr. Hemant, and the team, all team members of all of you.
Hats off to you, sir, to participate at this age also. Hats off to you,
Yes,
sir.
And Dr. Hemant.
Basically, I practice diabetes as a family physician, and I keep on joining PHFI. A lot of 10 courses I have done with Public Health Foundation, and right now I'm learning gestational diabetes and again diabetes course. So I enjoy just learning. I just enjoy more than practice. I enjoy learning.
Yeah,
really appreciate, sir. Yes. Really appreciate. Excellent. Thank you, sir.
Avinash.
Yes, sir. As usual, very well. Yes, sir. As usual, very well conducted, and this year very novel concept as Maha IAP has been doing since beginning of this year. So another great achievement to this team for this year, and I'm very happy that they included the general practitioner to reach to the wider audience. And hats off to all of the Maha IAP team. Thanks.
Yes, sir. Yes, sir.
Yes, sir.
Dr. Hemant, before I thought that you conclude, one question which has remained unanswered and very important, let me say, ceftriaxone. Number one, ceftriaxone never give it directly intravenous, never push it. It should be in infusion drip only. And that is over the time of 45 minutes to 1 hour. Second, don't consider that the ceftriaxone is totally safe and away from the anaphylaxis. Compared to penicillin and other preparations, yes, but not totally safe. And it has been reported even deaths due to the ceftriaxone. So don't take it lightly and don't even treat as the outdoor patient or at home, sometimes what the people are doing. So it is very important. In short, ceftriaxone, keep in mind that anaphylaxis can develop, keep in mind. Second thing, never push it, and it should be given in the infusion drip only. I think this is because ceftriaxone is very commonly used antibiotic. So I thought that in our practice, if you are aware, it will help a lot. Thank you very much.
Sir, I have seen 3 reactions to ceftriaxone, and one of the reaction was to my elder son when I gave to him itself. So that anaphylactic reaction has
absolutely
yes. So it is very, should be very careful. One should be very careful.
Should we give test
So
dose?
always in OPD practice, I advise in most of the medical legal talks also, always in OPD practice, keep one syringe filled with adrenaline ready. If you are practicing that. So you should always let it go waste at the end of the day. No issue, no problem. But keeping one syringe filled with adrenaline, and it should be at the axis of the hand. Neither ikade bhaga, either leke aao, udhar leke aao, we cannot find the adrenaline. That's it.
I think regarding somebody asked the test dose, routinely we don't go for the ceftriaxone test dose, but once you give the infusion drip and once you start it slowly, initially for some time you are getting the time to develop this allergy reaction or not. And therefore that is the benefit of even this, suppose if you have pushed it, now everything has gone. But in the infusion drip, you can stop it and you can treat it. So I think not directly exactly we are doing the test dose, but definitely we are following it. So it is there.
Thank you, sir. Thank you, sir.
Sir.
मला वाटतं
गंगोले सर conclude करायचं
anybody has to say and
sir,
after
sir, one thing, sir,
Rajesh,
Madam,
yes.
Madam,
sir, from the entire team of our Vidarbha Pedicon being organized in January 6, 7, 8, I extend a warm welcome to all the dignitaries on this platform, sir. So please make yourselves to grace our occasion, and please, sir. It's from the entire team of Yavasmal IAP, sir.
So,
thank you.
So we are at a concluding note, but anybody wants to speak, they can come forward. I am seeing Rajesh. When anybody wants to speak, can come 1 minute.
Yes,
when they can come to talk, and then Amol say for a few lines, and ultimately last will be Dr. Jay with his shairi. He will end this session, and anybody is there can talk.
Thank you
Yes,
very
Rajesh.
much. सर्वप्रथम मी डॉक्टर गंगोलिया सर, डॉक्टर पवार सर आणि त्यांच्या सगळ्या टीमचं खूप थँक्यू म्हणेन, कारण त्यांनी एवढं सगळं डायस एवढा मोठा आम्हाला उपलब्ध करून दिलं. त्याबरोबर जे स्टॉलवर्ड्स आहेत, बलदेव सर असतील किंवा मग जयंत जोशी सर, यांचं मार्गदर्शन आम्हाला इथे लाभलं. डॉक्टर दाभाडकरांचं तुम्ही, डॉक्टर जे आमचे भीष्म पितामह, त्यांचा तुम्ही उल्लेख इथे जरूर केला. त्याबरोबर जय भांडारकरांसराबरोबर माझं नेहमीच इंटरॅक्शन असतं बऱ्याचशा वेळेला. पण सर ह्या IAP मुळे, ह्या क्विजमुळे मला एक एवढे सगळे मित्र आज नवीन जोडता आले, त्याबद्दल फर्स्ट ऑफ ऑल आय एम थँक्यू टू ऑल ऑफ यू. डॉक्टर पंडित सर, ज्यांची माझी कधी ओळख नव्हती, पण आज ह्या प्लॅटफॉर्मवर त्यांची, ते माझे टीममेट होते, ही वॉज माय कलिग, आणि या सगळ्यांची ओळख तुमच्यामुळे मला झाली. आणि फ्रॉम बॉटम ऑफ माय हार्ट, फ्रॉम टीम मुंबई कोकण, I really thank you for giving this opportunity to all of us. Thank you very much.
Dr. Rajesh is extraordinary person,
Well,
working
sir,
at a very remote
sir,
place.
sir,
With all
sir,
remote, all resource limited settings, but is doing extremely well. Yes, Dr.
Sir, one thing remains. I would like to congratulate Dr. Vishal Raut, who is always hiding behind the scenes. He's one of the playback singer, or he's backbone of all this. The Vishal Raut, he will never come in front of us, but I would like to thank him also.
He has to come
yes,
now.
Rajesh sir. Yes, Rajesh sir. Then I will ask Dr. Hemant Shevale sir to speak few words. Shevale sir.
Thank you, sir. Thank you very much for making available platform to general practitioners to share our knowledge and to increase our knowledge. Thank you especially for Gangulia sir for reminding me. Thank you very much, sir.
Yes. So lastly, I thank all the experts, Dr. Baldev sir.
Dr. Amol, आपले जे कोण आहेत, नेहा बोलायला आहे, नेहा, सुनीता आणि कोण नाही, दुसरं विशाल, तिघांना सांगा काय बोलायचं बोला, नंतर देन यू स्टार्ट.
हा, ठीक आहे. विशाल बोल बाबा पटकन. विशाल, लाजू नको.
चालू द्या तुमचं, आहे मी इकडे. यू कॅन कंटिन्यू सर, आय एम लिस्निंग. नॉट अ
चेहरा तर दाखव आम्हाला, लोकांना कळायला पाहिजे की विशाल कोण आहे हा.
येणार नाही
ते. नेहा बोलो. Neha, please speak.
Yes, sir. Sir, I'm extremely grateful to be part of this antibiotic awareness quiz, and congratulations to all the team, best wishes. And sir, this type of arranging this type of quiz is really very wonderful, and bringing all together the whole Maharashtra at one platform is awesome. Thank you, sir. Everyone, all the participants have done wonderful. Thank you to all of them, and thank you to Gangolia sir and Amal sir. Thank you, sir.
Yes, Neha. Yes, Neha. I will ask Dr. Sunita Ingle, ma'am, because she had done all the scoring, and she will speak few words now.
Yeah, thank you so much for giving me the opportunity of scoring. I think I'm the permanent scorer for IAP group. Anyway, sir, it was wonderful. Dr. Prajapati sir, Dr. Joshi sir, thank you so much, sir, for very clear-cut messages. And it was a learning experience for me also. Though it was basic, but it's like going back to basic and relearning everything. So thank you so much. Wonderfully organized, crisp questions, and very nicely conducted quiz. Thank you.
Okay. I thank Dr. Baldev sir, Dr. Jain Joshi sir, who have given consent to be an expert for this quiz. Then Dr. Chetan Trivedi sir was there as a chief guest today. I thank Dr. President Dr. Gangolia sir for coordinating this quiz, Jai Bhandarkar sir for mastering this quiz, scorer Dr. Sunita Ingle ma'am, Neha, Vishal for all their contribution to the quiz, and last, mainly, I want to thank all the 5 executive body members of Maharashtra IAP from all 5 zones to help us in coordinating this quiz and to make available the team members also. I thank all the participants, our general practitioner friends for their contribution and for their participation in this quiz. And I thank Pallavi ma'am also for the backup support. Over to you, Jay sir, for your final remarks and shairis and all this. As we are nearing to the 12 o'clock, it's almost 12 a.m. now.
Dr. Jay,
Jay sir.
Jay.
Has he left?
Yes. No, he is there, but.
खाना खा रहा रहेगा किधर तो भी.
सर गंगोले सर तुम्हीच काहीतरी शायरी करून द्या मला.
Dr. Jay is there?
मी कॉल करतो तोपर्यंत बोला तुम्ही 2 मिनिट.
Yes, yes.
एक गाणं होऊ द्या, नाहीतर याचं पण अमोलचं.
नाही बाबा, गाणं बिनं ते नाशिकला गाणं ते पाठवा लवकर नाशिकला.
चलो अमोल, can I leave?
Yes sir.
एकच मिनिट जय आला तर ठीक आहे, नाही तर
आता तुम्ही गाणं म्हणायचं ऐकायचंय का? मी
तर आम्ही तुम्हाला सोडणार नाही सर.
मी गाणं म्हणायचंय का आता?
हो म्हणालो सर, म्हणा सर.
सोबत राहा तर फक्त.
सर म्हणा.
पण काय स्नेह, आता काय मराठवाड्यावर अन्याय झाला ना?
लागतोय फोन जय सर.
नाही सर, मराठवाड्याला जय सर
यायची सवय सर.
अच्छा,
जय सरांनी फोन उचलला नाही. मला वाटतं आपण एंड करूया.
Yes.
Hemant sir,
thank you, Baldev sir.
So thank you very much, each and everyone. Already the vote of thanks given by Dr. Amol, and thank you from my bottom of heart. Lots of participants who really came out, because it's very whenever this such program is there, quiz program is there, anyone coming out and participating is a great thing. For me, all are the winners. All participants, all 5 teams, all 25 member participants are the winners, and they have really done wonderful work. And because of them, this event was possible. And I thank you, each and every participant. They are the main heroes of today's session, and I thank them all, as well as 5 EB members from all Maharashtra who have gathered these teams for us. Thank you very much. And to coordinate everything, सर्वों को एक जगह पे लाने का, Dr. Amol, hearty congratulations to you. This I will tell this idea, just because this PPT is everything is ready with me, always is ready with me, but this idea came on Friday, I think so. I and Jay talked. Jay ने call किया अमोल को, अरे अपने को 5 टीम मांगता है, अरे 2 दिन दे दो ना. All idea clicked from Saturday, and now today is Thursday. Within a span of 5 days, we could do all these things. So wonderful! Thank you, everybody, and thank you. And last not the least, we got an extremely great person, stalwart, teachers of teachers, Dr. Baldev Prajapati sir. Thank you very much, sir. Thank you very much, sir. As well, Dr. Jain Joshi, he is always active from Pune. Thank you, Dr. Jain Joshi, sir, also. And all the best wishes for your future endeavor also, Dr. Jain Joshi, sir. Thank you.
Thank you so much. Thank you, Baldev bhai. It was great
Thank
being
you.
with you again. Seek your blessing.
Thank you, Baldev
so
sir.
much.
Dr.
you.
Neha,
Thank you all. Thank you all.
Dr.
Thank
Neha,
you.
you can